We've never done a virtual event of this sort. That we will serve. Mr. Polk, you ready?
I'm ready. Go ahead, you ready?
Good morning. I am Roy Charles Brooks, Commissioner of Tarrant County Precinct 1. And it is my pleasure to invite you to Healthy Lives Matters 5th Annual Alzheimer's Education Event. And just parenthetically, it's our first virtual event. This pandemic that we're living through has forced us all to figure out new ways of doing things to continue to serve the populations that we serve. This is our 5th annual Alzheimer's event. We got into this event because I watched my mother go through the Alzheimer's journey. I watched as the disease ravaged her mind and her memory, and finally her body. My siblings and I were fortunate in that each of us were pretty well resourced and were able to band together as a sibling group to give our mother excellent care. But in the doing of that, it occurred to me to wonder, what about those who are not as well resourced as my siblings and I were? What are they to do to provide that same excellent, loving care for their loved ones traveling the same journey? Well, we figured that an event like this annual seminar could lead people to the information that they need to provide that care effectively, could point the way to community resources that would help ease their path as they walk through the Alzheimer's journey with their loved ones. Could teach them about the family issues and the legal issues and the social issues related to giving long-term care to to a loved one. This has been a work of love for all of us. And doing it virtually, we'll see how it goes. But thanks for joining us this morning. We could not put on this event without the help of my capable staff, all of whom are here this morning. There's Roderick and Jeanette and Amanda and Stephanie and Michelle. And then there's Mr. Leon Polk, my subject matter expert on all things Alzheimer's, whose fingerprint you will see on every event, every presentation, every PowerPoint slide. It's all Mr. P. So I want to thank my staff for supporting this event in every way possible. We also could not do this event without our honorary staff member, Rachel Ariano of the County Judge's Office. She's been with us every year at this event, and I thank her for her consistency, and I thank the Commissioner's Court for the use of this beautiful facility this morning. Also, we've got some sponsors and community partners that we must recognize. United Way Area Agency on Aging is our bronze sponsor. The Alzheimer's Association of North Central Texas. The UNT Health Science Center, Center for Geriatrics. Dementia-friendly Fort Worth. United Healthcare. Aetna, Cigna, Texas Health Resources, and Baylor Scott and White have put their shoulders to the wheel with us every year and helped us push this boulder up the hill. And our community has benefited greatly from their support. Now it's a pleasure for me to introduce Jeff Bird, Executive Director of the Alzheimer's Association of North Central Texas, for a welcome. He's on video this morning.
Hello, my name is Jeff Bird. I'm the Executive Director for the Alzheimer's Association here in North Central Texas. And I am so pleased that I was asked to offer some opening remarks here for the Healthy Lives Matter Alzheimer's Education event. We of course want to thank Commissioner Brooks and his team for putting on this event year after year. And we're excited to be part of the 5th year of this amazing education event. We want to thank Commissioner Brooks and his team for their partnership, for their support, and for understanding what a devastating disease Alzheimer's and dementia is. We're grateful that you're here, and despite the pandemic that we're in, this challenging year, that you came looking for education, support, and resources. I want you to know that the Alzheimer's Association is here to help. We have a 24-hour, 7 days a week helpline that is there to answer questions for you, provide local resources, help in a time of need, or just listen when you're having a particularly struggling night. That number is 800-272-3900. And again, we're there 24 hours a day, 7 days a week. You can also check out alz.org for additional resources to learn about support groups and education events right here in Fort Worth or the surrounding area. Again, we are grateful for Commissioner Brooks, Leon Polk, and all those that put this event together. Looking forward to a wonderful day of education, support, and just bringing us together and knowing that we're not alone through this difficult time. Thank you, and enjoy the conference.
Thank you, Jeff, for that greeting and for your continued partnership with Healthy Lives Matter. Before I introduce our moderators for this morning and kick off this event, I want to remind all of you who have joined us on Zoom that if you have questions, you can go to the chat room and enter your questions into the chat box, and we will get to answering your questions at appropriate times during the presentation this morning. So anytime you've got a question, go to your chat box, enter your question, and we'll answer it as quickly as we can get to it. Now this morning we are fortunate to have two outstanding moderators for today's panel. They are Dr. Jennifer Severance, Assistant Professor of Geriatrics at the UNT Health Science Center of Fort Worth, and Dr. Sandra Davis, Assistant Professor of Internal Medicine and Geriatrics at UNT Health Science Center, Fort Worth. Thank you, ladies. I will now turn the program over to you, and let's get her started.
Thank you so much, Commissioner Brooks. Thank you. We're going to go ahead and get started with Shelley Young. She is the program manager of the North Texas chapter of the Alzheimer's Association, and she will be joining us via Zoom.
Well, good morning. Can somebody give me a thumbs up, hearing me and seeing me? Great. Wonderful. Wonderful. Well, I just want to shout out to everyone as well and say thank you so much for joining us this morning. A huge thanks to the commissioner. We appreciate him so much. He's been serving Fort Worth for many, many years and a great friend of the Alzheimer's Association, and we love the staff that work with Commissioner Brooks, and I want to give a great big thank you to everyone. And I also wanted to say, one of the things that I see and hear over and over is that Fort Worth is a great place for partnerships and collaboration. And so today's program is an example of a collaboration that's working really well. And again, we're just so thankful to be a part of this relationship. So I'm going to go ahead and share my screen. Are you seeing, can somebody give me a thumbs up? Are you seeing that? Okay, great. Wonderful. So just again want to reiterate a little of what Jeff was just saying about the Alzheimer's Association. Okay, there we go. A little tiny bit of technical difficulty. So I have to tell you that some of what we're going to talk about today is ways to really strengthen your brain and to embrace cognitive health and wellness. And one of the things we know we can do is learn new things. And during quarantine, I have learned all new things, including how to share my screen and do some things via Zoom. So feel encouraged if you have been challenged by this time of quarantine, that it may have actually benefited your brain in the process. So again, the Alzheimer's Association exists to really help people on their journey of caregiving, also people who have Alzheimer's or dementia-related diagnosis. We're here to help them as well. We do a great deal of work with funding global research. And so we just want you to know that you can always reach out to us any time of the day or night. One of the things that you'll actually see in our mission statement is that we want to be at the forefront of helping drive risk reduction. We want to look at ways that we can help people either prevent or delay the onset of any type of dementia. And so that's what we're going to dive into today. But I'd like to share, first of all, a lot of us talk about our reason why, or my reason. And so this is my reason. This is Mom and Dad, Ed and Carolyn. And in this picture, you'll notice my mom is actually the person with Alzheimer's disease. She was diagnosed around the age of 70. And it's interesting to me, first of all, that if you just glance at this picture, you're not going to notice that anything is really going wrong with my mom. You can't tell that she has cognitive challenges. But she was about 8 years into her disease progression. At the time this picture was taken, it was actually on my parents' 50th wedding anniversary, that her brain is literally dying. She had been so advanced at this point of this picture, she could not string words together. She did not recognize family, and if she did, there might be a slight recognition, a flicker of recognition, but certainly she didn't know names, she didn't know the relationship, and it was just so sad. I mean, she truly was a shell of who she had been previously. And so it's so important that we talk about these things. And one of the things that is that if you have Alzheimer's in your family, it does put you at higher risk for developing the disease, but it does not mean that you absolutely will. And there is evidence that the more we embrace healthy lifestyles, again, that we may be able to either delay or possibly prevent that. And that's why I'm here today. That's why I do the work that I do, is to help people on their journey. And let me just say, there's some discussion. A lot of folks are hesitant to say with 100% certainty that we can prevent or delay, but there's a lot of good information there is that, and so that's where we really start our conversation. So let's move a little further. So just briefly, we know there are different things actually that impact the way we age. So one of those things is genetics. So if we have some genetic risk factors that may put us either at higher risk for Alzheimer's or other illnesses as well. We know that lifestyle can impact the age, such as the things that we bring into our body, such as how much we move, such as how much we train. And the last thing is that there can be environmental impacts. It may be that you live in a place where you're not able to move as much. Maybe you're in a big city that doesn't allow you to get out and participate in a lot of physical activity. Or you're in a place that maybe the air you breathe is not as healthy for you. So these are some of the things that we know impact the way we age. I thought we'd also talk about some research that is ongoing or has been happening for a while that you may find interesting. Thing that is the super agers. I don't know if you've ever heard of a super ager, but super agers are people that have been identified. They're in their 80s or above, and they have they exhibit cognitive functions comparable to that of an average middle-aged individual. And scientists believe that average person's memory peaks in their 30s and begins to decline thereafter. But super agers follow a different trajectory. Their brains seem to age much slower, and when they reach the age of 80 or above, their brains look and behave like the brains of people decades younger. So these individuals have several things in common, including they embrace physical exercise, they engage in intellectual challenges, they maintain strong relationships, and they also eat healthy diets. So these are some of the things we know are working for these individuals who are super agers. And one more thing, we actually know that these individuals tend to drink a moderate amount of alcohol. Now, if you don't drink, I'm not suggesting that you should take it up now, but just know that that's something that we have seen through research that can be helpful and possibly preventive and beneficial to the brain. Also wanted to highlight, there was a study, I believe it started in 2009 in Finland. It was called the Finger Study. And this is one of the first large scale studies where they really looked at, they took individuals who had some risk factors for developing dementia, and they had these people engage in a multifaceted lifestyle modification program. And so these individuals did several things to improve their health and wellness. And this study really showed that there are some tools that we can use for prevention. And then more recently, here in the United States, the Alzheimer's Association has funded the US Pointer Study. And the US Pointer Study took some of the same concepts that were developed in the Finger Study and is looking at them across a much more diverse population. So in Finland, the population is they have more genetic similarities as well as their lifestyles are fairly similar. And so here in the US, we're looking at a much more diverse population, and we're diving into the benefits of, again, exercise, eating right, social engagement, those types of things to see the benefit across these diverse populations. So these are some things that you may actually, when we finish today, you may just want to Google some of those things, dive in a little bit deeper and learn what the research is showing related to prevention. And now they are actually using the term prevention studies. And so I just thought you might find that interesting. So we're going to start today by talking about sleep and the benefits of sleep on cognition. And so I reached out to Dr. Michael Scullin. He is a researcher and professor at Baylor University, and he has worked with the Alzheimer's Association on some different conferences. And so I asked him if he had some information that he could and would share with us. And so I want to read a little bit about what he said. First of all, he does work, so he runs the Sleep Neuroscience and Cognition Lab at Baylor University. And he states, there is a connection between poor sleep and dementia, though we're still working out which causes which. Sleep does get worse with disease progression, but there is now enough evidence that poor sleep is associated with later diagnosis, that people should definitely think about their sleep, not just their diet, their exercise, and their mental health. And he goes on to say, sleep is important for every organ in the body. It helps our immune system and it refreshes our brain. It helps to clear metabolites out of the brain, including things like beta amyloid. And beta amyloid is one of the hallmarks of Alzheimer's disease. He states, with poor sleep, our prefrontal cortex doesn't function as well as it should. And our prefrontal cortex is important to attention, decision-making, and emotion regulation, just to name a few. So I think he makes a good case for us taking better care of our sleep. And let's be honest, I think all of us, as we, if we're not sleeping well, we feel grumpy, we have a harder time focusing, and it really just affects how we feel. So we know that sleep actually helps every organ in the body. It helps our immune system. It refreshes our brain, and then again, it helps to clear out the beta amyloid that builds up in the brain of people who have Alzheimer's disease. So maybe the most important question related to sleep is, well, what do we do about it? I think we're seeing more in the news about sleep and the importance of it. But for those of you who have a hard time sleeping, let's talk about some practical aspects of getting better sleep. And these are all, again, coming from Dr. Scullin. And I will supply or provide a handout that he actually gave to me where he created some information on how to sleep. And he says that you can get better sleep starting tonight. One of the things that he strongly suggests is that we turn off our devices at night. I don't know about you, but I typically, the last thing I do before I go to bed is actually watch the news. And that may not be a good thing for a couple of reasons. One is the blue light of the television, but also just the emotional impact that news can have on us. So it may be that we need to look at a little bit before bed, or even doing a very simple meditation or some things that can set us up to have better sleep. He also says that we need to avoid caffeine at night. He mentions that caffeine use delays sleep and can decrease our slow wave sleep. And slow wave sleep is restorative for us.
Shelley, we have 1.5 minutes left.
I'm sorry, how many?
1.5.
Oh, wow. Okay, well, I will speed things along. All right. So let's talk for just a minute then, and I will make sure that you have all of the information that I'm sharing and the resources as well. So let's just talk a little bit about food. Again, I think most of us know the importance of food in lives and diets, but I found a really interesting description of how food benefits us that I thought I would share with you. This is from Dr. Eva Selhub with Harvard Health. States that your brain is always on. It takes care of your thoughts and movements, your breathing and your heartbeat and your senses. And she compares our brain to a car. She said, like an expensive car, your brain functions best when it gets on eating high quality foods that contain lots of vitamins, minerals, and antioxidants that nourish the brain and protect it from oxidative stress. So the two things that we know that the two diets that are particularly beneficial for brain health, one is called the Mediterranean diet, and another is called the DASH diet. And again, you can just Google those and get information about the benefits and what it would look like for you to engage in these. But both of them encourage high daily consumption of a variety of vegetables, whole grains and healthy fats, weekly intake of some fish. They both suggest limited intake of red meat. A DASH diet also puts an emphasis on lowering your sodium intake and lowering sugar sweetened beverages and sweets. And again, those are things that we hear a lot about, but I think it's hard for us sometimes to fully engage and do those things. So I'm going to talk in just a minute about how we get started with embracing a more healthy lifestyle for brain health. And then the last thing I want to talk about is the general benefits of exercise. We know that exercise helps us maintain a healthy weight. It reduces our risk of heart disease, and we know there's a direct connection between heart health and brain health. General exercise can help manage your blood sugar and insulin levels. We know that it improves mental health and mood. It does help promote better sleep, and it improves brain health.
Thank you, Shelley. It's encouraging to know that there are things that we can control that affect our brain health.
Yes. I have one more slide I want to share.
Sure.
Okay, I'm gonna jump ahead. Well, actually, slide. One is just, if you know that you need to make some changes, then I would really encourage folks to start today. And so even if you can't go out and take a walk today because I think it's going to be pretty hot, I would just encourage folks to maybe today you're going to make a plan. You're going to talk about even one small thing that you can do to start to change, whether it's related to healthy diet, moving more, or getting better sleep. Certainly get support from your doctor and support from others as well. Most of us do much better when we have accountability in a lot of different aspects of our life. And so, again, here is our 800 number for the Alzheimer's Association. If you have questions related to the things we've talked about today, you can actually call that number and they can send you information on things that promote brain health. Also, if you go to our website, alz.org, there is a page that actually, if you just type into this 10 ways to love your brain, that's some really simple things that you can do related to brain health. Another thing you might do today, if you have time, is check out our e-learning class. Again, it's at alz.org, and it's called Healthy Living for Your Brain and Body. And that actually takes about an hour for you to go through it, but that could be a really good activity on a hot Texas day. And then lastly, if you have any questions, if you need to reach out to the association related to caregiver stress or concerns, or if you have questions about what I've talked about today, please feel free to email me and I will be glad to respond to that and do what I can to help you on this journey. So thank you so much.
Thank you, Shelley. And I want to remind everyone, if you have questions, please put them in the chat box. We're going to go ahead and present our next presenter, who is Andrea Baum. She is a co-founder and Improv for Life director at the Stomping Ground Comedy Center. Go ahead.
Thank you so much. You're probably wondering, why is someone from a comedy theater here? So I actually have a story too, just like Shelley was talking about. My father has dementia and also acquired brain injury, which he's had for many, many years, since I was 15 years old. So that caused a lot of stress for our family, a lot of issues with the dynamics, with the relationships that we had. And when we were interacting with him, it was quite stressful for us. And I, as a psychotherapist, I was researching in my graduate studies of how to help families, caregivers, and to lower the stress, because I saw the toll it was taking on our family. It was just changing everything with our family. And in my spare time, I was also doing improv comedy, just for fun. And then I learned that the process of learning improv comedy and the skills that it teaches you is actually parallels really wonderfully with how to be a good caregiver, but not just a good caregiver, how to lower your stress as a caregiver, your physical, your mental exhaustion, and also how to have a more joyous interactions with our loved ones. So you may have had a relationship with your loved one that you had before dementia. They were diagnosed with dementia. And now I invite everyone to kind of conceptualize what that dynamic might look like, and that you can actually have more joyous interactions with them than before, even though this is a really stressful type of caregiving. I'm not sure, is there a PowerPoint? I do have a PowerPoint and I don't have it up yet. There we go. So I created Stomping Ground Comedy Theater to help people with therapeutic comedy. So I'm going to teach you a little bit about what that is. We have a program called Improv for Caregivers, which is experiential learning workshops. I'll give you information at the end. We actually have free workshops that we're offering online to caregivers right now. And they're all experiential. They're very fun. And there's a lot of laughing involved. So I promise. So what is improv comedy? It's a form of live theater where people make up things on the spot. So all the characters, all the dialogue, all the scene work is made up on the spot, and you usually get a one-word suggestion. To see really, if you ever see really good improv, those people, those performers have practiced. And there's a lot of rules and guidelines, and those are the things that I'm going to teach you a little bit about today. So if you're watching a show, if you go to an improv show and they're not, and they're kind of hitting the marks on everything and they're going with all the rules, it's usually very funny. This is a baby that's watching a very funny improv show. You can see they're very delighted, right? They don't even know how it's happening, but it's happening and they're just very pleased. Now, this is a baby watching an improv show that not so great. If you see a lot of audience members cringing, it's usually because they haven't practiced the skills well enough. They're not skilled at it. So what does the process of improv actually teach us? So when we're learning this, it teaches us things like active listening, communication skills, creative expression, collaboration, adaptability, authenticity, but also a lot of other things. I mean, communication and connecting, if we can learn that in our communication skills with everyone in our life, it can make things a lot easier. But specifically with when we're caregiving, we are in a very difficult situation because our loved one is changing a lot. And there are a lot of difficult behaviors that come up. And difficult behaviors like being frustrated or being aggressive or any agitation, that can all come from, one thing that it can come from is from stress, from a stressful relationship, a strained relationship with the person that's caring for them. So when caregivers are able to I really want to help you all today to have a new roadmap. If you can shift the way that you're communicating just slightly, it can actually make a world of difference. And for me, it was really life-changing. And the people that, the caregivers that we've helped, it has been really life-changing too, in decreasing their stress and their exhaustion and also their loved ones. So first, let's talk about this concept of yes and. So this is a big concept of improv. A performer comes on stage and they say, we're on the moon. The next performer comes and says, yes, and next we're gonna go to Saturn, right? So they add information, they step into the world that the person is creating, and they create this really fun thing for the audience to watch. And they support the person because they're listening and they're validating and they're adding information. How does that, and now if they came on the stage and they said, no, we're not going to the moon, that's never happening, it wouldn't be fun, right, to watch, and they wouldn't be going by the rules of improv. So how do we use that with our loved ones? We sometimes when we first go into caregiving, when our loved ones first get this diagnosis, there's this inclination to reality check them, to teach them, to lecture them, almost like you would do with a child who's developing, saying, oh no, the milk, remember the milk doesn't go in the pantry. The milk goes in the refrigerator, and kind of reteaching. But what we have to remember with Alzheimer's and dementia is this is a degenerative disease, and there is no relearning at this point. And also that leads to a lot of frustration when we start to reality check. There's a lot of grief, and part of this is the grief process of us trying to hold on to our loved one. And if we can try to move forward and say yes and to their world, it can help us move forward. And it can help them tremendously. So I want to give you all an example of a situation that was it's a tough situation to try to yes and step into the world. When there's there's memory loss, there's confabulation, they're making up things, and you want to tell them, no, that's not, you want to tell them what reality is. So I invite you to not, and to step into their world, because that is their reality. So an example with my father, he, like many of the people that you're probably caring for, he was not allowed to drive anymore. And they took away his keys, or we took away his keys, and we were his power of attorney. And so every day I saw him, he said, I want to get my driver's license, I want to go drive. And he would get very upset about it. But the reason he would get upset about it is because I would reality check him. And I would say, you can't. and your doctor said you're not allowed to. And remember, we were sitting there and they told you, and we have to listen to our doctor. And I would go, and then I would start using fear tactics. What if you killed someone? What if you got lost? And then we would be liable. Then you would go to jail. So I went from reality checking to fear tactics, and we know that none of that works. And it took me years and years to learn that that was not the route to take. We would both be left with a lot of frustration. He would be getting more angry, trying to prove why he needed to do that. So how do you yes and something like driving a car? Because I can't say, yes, and let's go get a car and drive off right now. So part of what improv teaches us is connecting and validating too. So first, doing something as simple, when you're having a difficult situation that you know it's kind of going to get you in a particularly stressful place, connecting and validating. So part of connecting is, first of all, matching their nonverbals. How are they sitting? Are you standing above them? How's that going to work in a communication when you're communicating and interacting? It doesn't feel good when people stand above us and talk down to us. So you want to get down on their level, match their nonverbals, match their tone, and have a smile on your face too, because you might seem like someone that is unknown to them, and that can be scary and that can be confusing. So something as simple as coming in with a smile in your first interaction with that person can make a world of difference. Think about how when you walk in anywhere and someone doesn't have a smile on their face and you can read them immediately, our loved ones still have that ability to pick up on these things. So smiling, coming into a room as simple as that and smiling can really help you connect and start on an agreement of yes and it feels safe and comfortable to that person. You feel familiar even though your face might not look familiar. So that's the first part. And then validate. You want to kind of repeat what you're hearing. So I would say, instead of reality checking, I would say, so I hear you saying you really want to drive a car. It's really important for you to drive a car. Yes, it is, he would say. Okay, how do I get out of this one now, right? How do you keep going? So then I would say, if you could have any car, what kind of car would it be? And then we started talking about cars. And then I'd say, if you could have a car that had wings and could take you anywhere, where would you go? Then we start having a conversation about this kind of fantasy world that we're making up, and we're having a conversation about something else, and we have now redirected the conversation. I listened, I connected, I listened to his needs, and then we move in that direction. So that made our interactions a lot more joyous. So when we can do that, sometimes, you find the milk in the pantry. Instead of saying, that's not where this goes, you say, well, that's a great place for this to go, and you just put it back. So saying yes to their world instead of feeling like you have to teach. Mindfulness, a lot of times we flip our lids, so to speak, where when you feel like you can't think straight because you're so frustrated as a caregiver and you feel so just out of control, that feeling when you flip your lid and you feel very emotional. Well, what happens in that moment is that your prefrontal cortex is no longer working. It's like you flip your lid, this is your emotional part of your brain right here, and this is all you're functioning from. So it's really hard to make decisions and to be calm and to be a nice person. So in those moments, you want to just take a brief moment, and I invite you to do a quick mindfulness, and you can all do it with me here. A mindfulness exercise. You can put your fingers like a triangle here, and you bring your awareness to touch. You bring your awareness to your vision, your sight. You bring your awareness to all your senses, and you take 3 deep breaths for each point on the triangle. And as you exhale, you just lower your triangle down for each exhale, and that brings down your shoulders, and it brings some awareness, get some fresh air outside. And that can help you to feel calmer very, very quickly. And you can also do that for your loved one when they have flipped their lid, and you can do it together. You can go outside, you can redirect their senses in a way, when they're particularly frustrated or agitated, and that can be really helpful. So We invite you to try all of these things. And lastly, as caregivers, I know that there's someone in your life that is asking you, how can I help you? Let me help you. And you're saying no to them. Say yes to that person. That person is asking you to help you for a reason. You have helped other people in your life, and it's time to take some help for yourself, even if it's just them coming over to your house for a few minutes while you can go take a walk or do something. It's really important that you are healthy. You know, we always hear that you need to put your oxygen mask on, and the research shows that caregivers, their health, their mental health, their physical health directly correlates to the person that they're caring for. So I hope that you're able to use some improv and get silly and have some fun with your loved one, and notice how you can have more joyous interactions, and you'll feel less stressed too. So thank you very much for having us today. And I wanted to let you know we have free improv caregiver workshops. They're virtual. They're very fun and interactive, and they are funded by the Aware Grant Dallas Foundation. And you can just get on our website or email me, and they're an hour and a half long. And we can also come to your support group for free too, depending on where you are. So thank you so much.
Thank you, Ms. Baum. I've seen great results with improv with caregivers. It's
Yes.
really amazing.
Yeah.
Thank you.
Thank you.
So we're going to move on to Dr. Seema Mosbar. She's assistant professor of pharmacology and neuroscience. She's an optometrist, and she works at the University of North Texas Health Science Center.
Hi everyone, I'm excited to be here today to talk to you about Alzheimer's disease and the aging eye. And wait a second for my PowerPoint to come on. All right, so we can go to the next slide. Today we'll be talking about how Alzheimer's disease is related to the eye. And then we'll talk about some visual manifestations of Alzheimer's disease and talk about some tips to improve visual function. And then lastly, we'll touch on some of the research being done in this area, looking at the eye as a potential biomarker for Alzheimer's disease. All right, so the eye is an extension of the central nervous system. The retina, which is the tissue that lines the back of the eyeball, and the brain share many characteristics. And you can see in the picture the eye is connected to the brain through a cable called the optic nerve. So neurodegeneration caused by disorders like Alzheimer's disease extends into the eye, and because of this, we see the visual system shows deficits early in the degenerative process of Alzheimer's disease. When we look at an object, visual information is sent from our eyes to our brain, and that's where images are interpreted. And the brain plays a very critical role in taking that visual information from your eyes and putting it together into an image that you can understand. So because of this, certain diseases that affect the brain can influence the brain's interpretation of those images being received by the eyes. And then lastly, we know that visual symptoms are very common in Alzheimer's disease. Patients with Alzheimer's have difficulty performing tasks like reading, driving, and other tasks that require visual cognition. And we'll get into some specific examples. So we know that Alzheimer's disease impacts visual function early in the course of the disease, and visual functional loss correlates with cognitive losses. We also know that visual impairment is associated with both an increased risk and severity of Alzheimer's disease. I've listed some changes we can see here that affect visual function throughout Alzheimer's disease and dementia. As you can imagine, all of these changes can affect performance on a number of daily living activities, which we'll discuss as well. I also want to point out that these changes can be very subtle and can occur very early in the disease process. So first we can see reduced visual acuity, or the ability to see clearly. This is particularly bad under low lighting situations like a dimly lit restaurant. And also as we age, we can develop cataracts, which is clouding of the natural lens of the eye, and that can contribute to blurry vision as well. Reduced contrast sensitivity is another finding that can be found very early in the stages of Alzheimer's disease. It's difficulty distinguishing an image from its background when subtle variations in tone are involved. And the contrast sensitivity is actually a very good predictor of real world vision. So when you have reduced contrast sensitivity, it can really affect your quality of vision and quality of life and impact difficulty with daily living tasks like the one I've listed here, including increased risk of falls and fractures. And so just like we wear sunglasses when we go outside to help us with the bright lights, you can actually wear different filtered lenses to help improve contrast sensitivity. Some other changes we can see are visual field defects. These typically affect the inferior visual field. So as you can imagine, that would cause difficulty with reading and near tasks, seeing steps and curbs, so orientation and mobility concerns, as well as just seeing your dinner plate on your table. So some changes might need to be made there to bring the images into the individual's field of vision that's working. We can also see reduced color vision. Primarily short wavelengths are affected, so blues and purples first, but all colors can eventually appear washed out. And there's also been some studies that show that color vision is the worse the MMSE score, the mini mental state exam, the worse the color vision is as well. So people with Alzheimer's may gradually lose their depth perception, which is the ability to see in 3 dimensions and judge the distance of an object. They may have difficulty distinguishing between flat pictures and 3D objects, or trouble judging distances. And depth perception is really important in our day-to-day life. It allows us to move throughout our day without bumping into things. We can tell how far away a wall is from us or how far we are from the car in front of us. Reduced motion perception, so the ability to detect motion is another finding we can see. So difficulty following moving objects, determining how fast a moving object is coming towards you, like a car or a ball. And then, like we talked about earlier, with the visual process, with the eyes sending the visuals images to the brain to be interpreted, people with dementia may see an object correctly with their eyes, but their brain may misinterpret what their eyes are seeing. So as a result, they may not be able to correctly or accurately name certain things or people. Also, as all of us get older, we're at an increased risk of developing age-related eye diseases or conditions that can cause vision loss or blindness. And I've listed the most common conditions, age-related conditions here. Some of these diseases have no early warning signs or symptoms, which is why it's so important to get your annual comprehensive eye exam, regardless of if you have any visual changes or not, to check the health of the eye. One recent study actually found a link between those with macular degeneration, glaucoma, and diabetic retinopathy and Alzheimer's disease. They found that those with those eye conditions that I listed are 40 to 50% more likely to have Alzheimer's disease. So that's an interesting area that's still being explored with research today. But the point of all of this is the combination of vision issues that you can get from Alzheimer's disease combined with age-related eye conditions that can occur can really put your vision at risk. So it's important to catch these diseases early in the process, treat them if they're happening, and we can do that through getting our yearly eye exams. So now we've talked about some of the changes that can occur and affect visual function in those with Alzheimer's disease. So this slide includes some tips to improve visual function and hopefully help improve performing daily living tasks with our vision. So low vision means you cannot fix your eyesight with glasses, contacts, medicine, or surgery. So an example would be very late stage glaucoma, and your eye doctor can show you some low vision resources in the community and set you up with a low vision specialist. And a low vision specialist can examine you and equip you with tools to help with daily living tasks. Some of these tools include large print reading materials, magnifying aids, closed circuit televisions like the picture on the bottom right, audio tapes, electronic reading machines, and so forth. So there's a lot of different types of tools that can help improve your visual function. Some other general tips, things you can do around the house is proper lighting. So brightening your room lighting is really helpful, and using an overhead task lamp as well. Writing with a bold black felt tip marker, or using paper with bold lines to help write in a straight line. Installing dark colored light switches and electrical outlets against a light colored wall can help improve contrast. Also, using motion lights that turn on when you enter a room can hopefully help avoid some accidents caused by poor lighting. And then using telephones, clocks, watches, and other devices with large numbers. You can actually buy stickers that have large print numbers on them and put them on the oven or the stove or the microwave, things like that around the house to help. Okay, so now I want to shift gears and talk about some of the research being done in this area, looking at the eye as a potential biomarker for Alzheimer's disease. This is my research area of interest, and we're looking at the usefulness of the retina as a biomarker for detecting Alzheimer's disease in primary care settings. So we know that the eye is an extension of the brain, and the brain and the retina share many characteristics. And because we can look at the retina non-invasively through an eye exam, this area has become an increasing area of interest as a potential biomarker over the last decade. So studies use ocular coherence tomography, which is this device I've pictured here, and most optometrists can provide this type of imaging. It takes a cross-sectional image of your retinal layers, and studies have found retinal layer thinning in those with Alzheimer's disease early in the disease process and well before your classic cognitive and behavioral changes are occurring. Using the same device, they've also found a buildup of the beta amyloid protein in the retina, which is the same protein that occurs in the brain in Alzheimer's disease and is seen via PET scan. So again, these changes are found well before your classic cognitive and behavioral changes. So although there's no definitive vision test to diagnose Alzheimer's disease at this point, the retina holds a lot of promise to serve as an early biomarker as part of a multi-tiered diagnostic process for Alzheimer's disease. An early diagnosis would enable treatment to start sooner and would hopefully slow progression of the disease. So our study is a sub-study of the Alzheimer's disease in primary care study, which is looking at a blood test for detecting Alzheimer's disease in a primary care setting. And so we are adding on our eye scans to this study. I've included their phone number here if you wanted some more information about the study or if you're interested in participating. There are some eligibility criteria, but you can call to find out more if you're interested. And then I just wanted to end off with some general tips for healthy vision. So as I mentioned before, many of the eye conditions we discussed have no early signs or symptoms, so this is why it's so important to get annual comprehensive eye exams. Protecting your eyes from harmful UV rays by wearing sunglasses or wide brim hats while you're outside is also important. Your eye health is related to your overall health, so maintaining a healthy lifestyle, eating a healthy diet, and getting safe, regular exercise if you can is also very important. And keeping control of systemic diseases, so conditions like diabetes and high blood pressure can affect your eye health if they are not controlled or treated. And then lastly, if you smoke, make sure to stop smoking. All right, so here are some websites. These are some resources that I recommend to patients. They have a lot of great information on eye diseases and disorders, as well as information about the aging eye, so you can visit these websites there. And that's all. Thank you for your time. If you have any follow-up questions, I've included my email here, so feel free to email me. Thank you.
Thank you, Dr. Mosbar. That's fascinating and promising information. I want to remind everyone that they can also leave comments on YouTube and on the chat. So next, I would like to present Dr. Joseph Laborde.
That's okay.
He specializes in periodontics and dental implants.
Thank you. It's an honor to be here. Thank you for including me, and thanks Commissioner Brooks. And so I am a periodontist and currently limited to private practice. But one of the main reasons that I went into periodontics was my interest in the the connection between the oral health and systemic health, and so I'm thrilled to be here talking about it today. Now, in private practice, things are different. I did my research initially on the connection with diabetes and periodontitis, but we see just such a broad range of different kinds of patients in our office and an aging population, and I've had the benefit and I've had the experience of treating patients that have been long-term patients for 30 plus years at our office, and watched a lot of patients and family members going through dementia and Alzheimer's disease, and have really grown a deeper appreciation for the difficulty that brings. So today I just kind of want to go over a brief understanding of gum disease and periodontal disease or periodontitis, how these diseases can increase the risk of other illnesses such as Alzheimer's disease, and then talk about what preventive measures could mitigate or lower the risk and then slow the progression of periodontitis or periodontal disease. So just kind of a brief overview, plaque-induced gingivitis, which is just run-of-the-mill or traditional gingivitis, is caused by just plaque on the teeth. Anyone will get this if they have buildup. The clinical signs are inflammation, redness, bleeding. This is a reversible condition, but it serves as a precursor to periodontitis. Now, periodontitis differs clinically and in other ways from just regular gingival or gingivitis, because we start to see a separation of the gum tissue from the tooth and the root surface. And this is what we measure when you're having your dental exam with the probing depths. So these measurements, if they're greater than a certain depth, we consider those pockets, which is a way we diagnose periodontitis or periodontal disease. And these pockets allow accumulation of plaque down beneath the gum line, and that plaque causes the body to continually react. This reaction can increase the depth of the pocket, can result in bone loss, mobility of teeth, tooth loss, and it has a slow to moderate rate of progression. Now, not everyone gets periodontitis, so that's one of our understandings of it now, and I feel like as all things medical, dental, as our understanding of things and diagnoses, grow, they become more complicated. But we initially thought it was just a bacterial infection, but now we understand it as more of a host or a body's response to that bacteria in the plaque. So it's more of a not everyone is susceptible. It's more of a genetic. There's always a genetic component, and there's also several other factors that influence or contribute to it. There's always bacteria. Generally, there's a genetic component. Other things that can make it worse or accelerate it would be clenching, grinding, which we're seeing a lot more of these days in the global pandemic. Smoking, other systemic disease such as poorly controlled diabetes, emotional stress, and then local factors in the mouth such as crowns that don't fit well that can accumulate plaque and bacteria. So when we look at x-rays, what we note for is there signs of bone loss? And this is a kind of a hallmark tell radiographically or x-ray that the prolonged infection or inflammation that the body's producing is causing the deterioration of not only the tissue but also the bone. Where in this picture, you can see the teeth and the roots and the bone, which is normally up much higher towards the crowns of the teeth. And so we've recognized that kind of the body's main reaction is an inflammatory response, and mainly a chronic inflammatory response. So that differs from an acute inflammation, which is the body's kind of primary defense and is generally, or can be a useful response. A chronic inflammation is often harmful, and it's generally an uncontrolled inflammation, resulting in damage to organs and different kinds of tissue. It often results from prolonged infections, such as periodontitis, and then there's these kind of blood mediators that we can check for to kind of establish, what kind of inflammatory markers there are in patients. So, the main reason or the main connection we see with other diseases is this association with chronic inflammation. So there are other diseases that are considered, chronic inflammatory diseases would be cardiovascular disease, diabetes, neurodegenerative diseases, including Alzheimer's, arthritis, rheumatoid arthritis, certain types of cancers. So there's kind of a negative feedback loop where the amount of inflammation overall in the body can increase your risk factors for these other diseases. And just looking specifically at Alzheimer's, there's been more and more research and to support this, that inflammation is a central pathology and likely plays a role in the onset and progression of Alzheimer's disease. And we also know that, based on several studies, that tooth loss and especially low number of teeth has an association with dementia, especially late in life. So, that kind of leads us to this, understanding that there's a relationship, because periodontal disease is the leading cause of tooth loss. So the kind of two different theories or mechanisms that periodontitis could be affecting or relating to Alzheimer's would be inflammation, like we mentioned, and then bacteria. And as periodontitis gets more severe, the bacteria starts to get more harmful, and we see different kinds of bacteria. There's been recent publications showing this one periodontal pathogen, this P. gingivalis, which has been found associated with Alzheimer's disease or an Alzheimer's disease. And whether it's causing a bacterial infection or it's just stimulating more inflammation, there's still evidence or further research that needs to be done. But there definitely seems to be a correlation or association between periodontitis and Alzheimer's. So, one of the aspects of our treatment is educating patients on these factors, and when we treat patients that have periodontitis or periodontal disease, our goal is to really eliminate the plaque and bacteria that's down beneath the gum line, because when you have those pockets, it's really impossible to do on your own, because with a regular toothbrush or cleaning, you just can't access that deeper, more harmful bacteria. So decreasing the bacteria and then decreasing the overall inflammation in the mouth, which helps to increase or decrease the inflammation in the body. So that reduction in can provide a general benefit to the the overall systemic health. So in terms of risk reduction, there's certain things that we can do, and when you have your regular dental checkups, they should be measuring your gum health with the periodontal probing. So early detection is one thing, because the earlier you catch the disease, your long-term outcome will be. So prevent progression of periodontitis. And so, really our main goal of therapy is to, like I said, is to kind of stop the disease from progressing. Sometimes we can get a little bit back, but stop it from progressing and make things stable, so that way we can get patients in a situation where they're able to maintain the health of their teeth and gums long term. So since it's a genetic condition, that means that even with treatment, these patients are always going to be at risk for relapse. So a lot of times, depending on the severity, we'll have an increased cleaning frequency. Sometimes we'll do every 3 months instead of every 6 months. And if you have gum disease, or if someone in your family has gum disease, that might be a motivation to get screened for it. And and then at home, there's always certain things that you can do. I recommend the ultrasonic toothbrush for everyone, but especially if you're at risk for or have gum disease, just because they brush more efficiently than you can with a traditional toothbrush. I'm a big fan of water picks for our patients, just because they flush things, and dilution is the solution to pollution. Especially if there's like hard to reach areas. A lot of our older patients, in addition to, if they have periodontal disease, are on multiple medications, and cavities aren't necessarily associated with gum disease, but dry mouth is a big problem in terms of like increasing the risk of dental cavities. So, and managing those, or preventing those with supplemental fluoride a lot of times can be beneficial. And then, for those that are caring for patients that are aging, or maybe have, given a diagnosis of Alzheimer's disease or dementia, really educating them on the importance of doing their best, within reason, and just to help mitigate things, and as things progress, to make that patient as comfortable as long as possible. So I know we'll have some questions at the end, and again, if you have any, this is my email. If you have any questions, you can always contact me. But I appreciate being here, and thank you very much.
Thank you, Dr. Laborde. So our next presenter is Dr. Laszlo Prokai. He is professor and the Welch Chair in Biochemistry at the University of North Texas Health Science Center.
I appreciate the invitation and the opportunity to speak about an issue that is more or less common knowledge. Basically, there is an increased Alzheimer's disease risk for women after menopause. The menopausal transition is associated to the ability of women to stop creating important hormones, estrogens and progestins. Basically, this is the hallmark of menopause. Hormone production normally decreases due to age and genetics, and like it has a domain of its own. So menopause occurs also when certain surgeries are performed that are associated with the complete removal of the uterus and ovaries. And the bottom line is when the brain is not receiving enough estrogens, it commonly reacts with causing the symptoms that are connected with menopause: hot flushes, depression, anxiety, memory problems, sleep disturbances, and hormone therapy is a common remedy for such menopausal symptoms. But when you look at investigations in scientific laboratories that using well-controlled cell culture and animal models and relying on the human estrogen, all conclude that the human estrogen, estradiol, is a potent neuroprotective agent with a premise to slow the onset and progression of, among others, Alzheimer's disease, but you can include all-cause dementia and basically Parkinson's disease and even ocular neurodegeneration that can be influenced by the hormonal status. Relying on, again, estradiol as a potent neuroprotective agent. But when you look at the observational clinical investigations, they more or less report that hormone therapy may protect against Alzheimer's disease and dementia, but then such positive impact is not fully supported by the really large-scale randomized, placebo-controlled, long-term clinical trial known as the Women's Health Initiative in its memory study branch. However, this is not the verdict, the damning verdict for the hormone therapies, because this study has been widely criticized because of cohort selection and simply helped us recognize that there is a window of opportunity for the intervention. That is, soon after the menopause, the onset of menopause, or even in the transition, the so-called perimenopausal state, we have this opportunity. If we are outside this window of opportunity, oftentimes hormone therapy just exacerbates the bad side of the menopause have been set in already. And also, if we look at scientific nomenclature, most studies do not distinguish non-endogenous and endogenously identical hormones. And if we look at the science behind it, like the mode of action, the molecular binding affinities that are associated with the presumably beneficial actions, and also the side of the bad side of the hormone therapy, which is associated oftentimes how the human body deals with these non-endogenous estrogens are critical, and also that these hormone therapies may be available in different pharmaceutical dosage forms. Just to highlight that Premarin, which is the mainstay of hormone therapy, as the estrogen component is concerned, is going to stand for pregnant mare urine. It's completely natural, but obviously it's not human, because they are so-called conjugated equine estrogens. To deal with a certain kind of side effects that are associated with, for example, increased endometrial cancer, basically they are abated by using a progestin, but nevertheless, sorry, I just tried to push the button to go back, but I probably wrap it up that these kind of ambiguities are going to, now here it is, so these kind of ambiguities in the meta-analysis, the scientific studies, significantly impacted and continue to impact the interpretation of data, meta-analysis, observational studies, specifically with relevance to Alzheimer's disease, but overall as well. So it's not unexpected that the U.S. Food and Drug Administration lists the benefits of using hormone therapy for menopause as far as brain-related symptoms are concerned. That it has to be restricted to relieve hot flushes and night sweats, but also the risks that are associated with the use of the hormone are quite abundant. Adding progestin lowers the risk for the side effects, but unfortunately, they are also associated by almost eliminating the beneficial effects on the brain. So overall, the question, if you ask yourself, should I use hormone therapy to prevent memory loss or Alzheimer's disease? The answer is a resounding no. The risks outweigh the benefits. So how to control the risk? Current hormone therapies simply flood the entire body with the hormone. Therefore, they increase the likelihood of unwanted deleterious side effects. So the key to have improved hormone therapy is to develop novel ways of administering estrogen therapy. For example, this is our method of an improved brain-selective estrogen therapy that would be inherently safe. And I listed the local company in the Metroplex. You can follow us on the Twitter if you are interested in this approach that we have published in Science Translational Medicine 5 years ago. And yes, we have preclinical animal models showing the benefits of this novel brain-selective estrogen therapy for potential treatment of Alzheimer's disease. The chart on the left is indicating a positive impact on the amyloid beta peptide level. Ms. Young has elaborated on the importance of the beta amyloid peptide, and the chart on the right is showing that the brain-selective therapy, in terms of looking at the marker of the unwanted side effect, is completely eliminated. Last but not least, I'd like to acknowledge the generous support from the National Institutes of Health. And also, I am obligated to disclose the financial conflict of interest. Oh yes, and basically we would welcome interest in terms of angel investors to take the currently experimental strategy from the bench to the clinic.
Thank you very much, Dr. Prakai. So I have a question regarding hormone replacement therapy and how it's been confusing and controversial. Are there any challenges in introducing a new novel agent into this area?
Yes, it's basically the Food and Drug Administration, although they lowered the bar significantly for Alzheimer's disease therapies to pass the hurdle of approval, regulatory approval, the commercial interest in Alzheimer's disease medication development because of the enormous attrition, like it has been diminished from the pharmaceutical industry. In other words, the pipeline for anti-Alzheimer's drugs by these companies is practically empty.
Very good. Is there any evidence that hysterectomies have any impact on the hormonal changes that are leading to higher risk in Alzheimer's disease?
Yes, there are risks, and basically with the surgical menopause, the onset of the neurological symptoms is almost immediate, as opposed to the natural menopause that sets in more or less gradually. And simply the neurological symptoms also include the neurodegenerative diseases, significantly increased risk.
Okay, thank you. So I have a question for Dr. Laborde. And you mentioned earlier that more frequent annual exams will help with prevention. This question is for patients with dementia and dentures. Mm-hmm. Is there any change in the recommendation as far as how frequent a patient should be evaluated?
If they are completely edentulous and have no teeth, then I think there's probably not really a need to come in, honestly, because there's the periodontitis is a disease that affects the teeth and gum relationship, so that is kind of eliminated in that circumstance. But if they have partial dentures, where they still have some teeth and they just have something replacing some of their teeth, then as reasonable as it can be, because I know as things decline, it gets more and more difficult to make those visits. So, that would be, a recommendation for those people that are still able to comfortably come and be aware of their surroundings.
Okay, good. Are there certain medications that affect oral health? And if so, should we notify our dentist of these medications?
Well, I mentioned dry mouth, and the list of medications that cause dry mouth is extremely long. So that's one thing, and I would say probably at least 50% of my practice has some level of dry mouth, often medication associated, and there's not a great cure for that. But there's certainly things we can do to improve it. The other thing is some of the cardiovascular or blood pressure medicines, the calcium channel blockers, or sometimes the anti-seizure medications can cause a gingival or a gum hyperplasia or growing of an excess gum tissue, and that can pose a real challenge if it's left kind of unmanaged, because the tissue kind of starts to grow uncontrollably, which makes it much more difficult to clean. So, and those are pretty common medications.
Yes, they are. So I have another question. If you're having regular periodontal cleaning, are implants feasible? Yes,
absolutely. So we place implants all the time in patients that have periodontal disease. The goal is to eliminate active disease, and once that patient is stable, then the evidence shows that they respond just like anyone else.
So this question asks, if somebody wants implants, is it worth the cost?
Well, I think obviously it is. I mean, it's important. I mean, on multiple aspects. Being able to function and eat nutritious food is going to have a long-term benefit. As you lose teeth, the rest of your teeth become more compromised because you have less support for those remaining teeth. And then, aesthetics and confidence. And I think, yes.
All right, thank you very much.
Okay.
So this question is for Dr. Mospar. When should one start to look for signs themselves if they have a genetic predisposition for Alzheimer's?
In the eye?
Yes.
So there's no definitive test right now that can tell us if you have Alzheimer's disease through an eye test, is what I mean. And so right now all you can really do is keep up with your annual eye exams. Your doctor might recommend for you to go more frequently if you have certain eye conditions that need to be monitored closely. And those changes that we see are also associated with some other diseases. So just getting your overall eye health checked out and being monitored for those is really all we can do right now. And then hopefully that relationship between eye biomarkers for Alzheimer's disease will continue to grow, and the research can validate it as a biomarker in the future.
Right. And I can also add, in terms of in general, we don't have any specific tests for Alzheimer's disease, but we are looking into blood biomarkers that will hopefully be able to detect Alzheimer's early enough to be able to treat and prevent illness. And we're doing ongoing studies for those types of blood biomarkers. And hopefully within the next year or two, we'll have some actual medication treatment available to help prevent the formation of plaques and tangles in the brain. So there are a lot of really new and exciting therapies that are coming. Okay, and this question is for Ms. Baum. This person asks, in my profession, which is in the inpatient psych setting, we are required to wear face masks. Any recommendations since the patient can't see my smile?
Ooh, that's a good question. You probably can't use those face masks where they're clear, right? I don't know. If you can, that would be great. Go look in the mirror and smile and walk in the room with a smile and some energy, and you'll see that there's a lot of other stuff that you're doing that are nonverbal that people pick up on. So you can see smiles in the eyes in the crow's feet. Don't get any Botox because then you mess that up for trying to connect with people. But you can see a smile in the eyes. You can be warm with hand gestures. Hand gestures are really important to show warmth. If you talk to someone and their hands are in their pockets, there's like fear that comes up. So those are some natural things that our brain goes to. So hand gestures, smiling with your eyes, and matching those nonverbals that you're seeing the patient do.
Great. So here's another question. What are ways that participants have been able to take the communication and confidence they've gained and make a positive change in other areas of their lives?
Oh, that's a great question. Well, we have seen people we've just really seen people be able to be so creative in what they're doing that they come up with ideas of how to help one another. And so supporting other caregivers, so going to support groups and sharing information like this with other people, sharing it with loved ones. Sometimes it can be challenging to have everyone in the family be on the same page of how you're communicating. So being able to show your loved ones in the family, like, look at how this conversation that used to go one way is going a completely different way, and really just showing others that and role modeling that can be really helpful.
Great. So some may see this as an opportunity to begin this type of program in their community. What is important to consider in integrating the therapeutic approach with the more creative artsy approach?
Well, it's for us, what we have found is really important is that you have people that are extremely knowledgeable, obviously, of about caregiving, and that there's a licensed therapist, and then also we have extremely experienced comedy instructors that make people very comfortable. So sometimes people aren't. It's really hard to get people to be involved and have this kind of courageous participation in these experiential activities that we do. So someone that's really good with connecting. But I would also say just hire us, right?
Great, great. So I have another question. This is more of a general question. It says, what signs should I be looking for that would indicate Alzheimer's may be coming my way? Does anybody want to take that question?
Maybe
Oh,
I
Shelley,
just,
are you there? Are you available to answer questions?
maybe
I
I just
am.
chime
Okay,
in.
great.
Like,
So can you help us with this one?
Okay.
I absolutely can. So one thing that folks might want to do is actually go to alz.org, and there is information. We actually have what we call the 10 signs. Alzheimer's, but one of the first is when you really start to see an unusual forgetfulness in a loved one, and maybe they're repeating themselves over and over again. And I have a really distinct memory of a conversation that I had with her, a lunch, where she told me the same story in about an hour, probably 6 or 7 times. And we had been seeing some in her, but that was one of those aha moments for me where there was no doubt that something was going on. But we see people, maybe they're getting confused or turned while driving. You know, maybe they've gone to the same church for 50 years and they can't find their way there any longer. We do sometimes with these individuals see vision changes, changes in their judgment, maybe some changes in personality or withdrawal. But I would check out the 10 signs, and that would be really helpful. And then call the Alzheimer's Foundation if you have questions or concerns about, maybe things that you're seeing in a loved one or concerns for yourself.
Right, I would agree with that. We also see what's called process memory problems. So things that, like opening the door, it's a memory that is very, you don't even have to think about necessarily. So that could be an indication if somebody's forgetting how to do things that they would normally do, like get dressed or cooking. Cooking actually takes a lot of steps. And so, having lots of different processes can be very confusing. So that would be another area that we see where signs of
Yes.
Driving is a big one. Driving, losing where you parked the car, and those can be very, very frightening to families. So kind of looking for those types of things. So if somebody is looking for earlier signs and symptoms, I think, looking at some neurocognitive testing would be helpful.
And is that in those cases, do you recommend that people go see their primary care physician?
Yes, definitely, definitely. Shelley, one more question. Can people with Alzheimer's disease sleep too much? Oh, does she
frozen?
Oh no. And so I can maybe address this. Usually, as you get older, your sleep needs decrease. So you don't necessarily need as much sleep, and you're not necessarily regenerating your brain cells as you're sleeping as much. So the requirement for sleep is less. Can they sleep too much? I would say yes, because you really want to keep your brain cells alive, and that requires you to be active and, interacting socially, and, if you can, reading, doing what you can, crossword puzzles, anything to keep your brain stimulated. So I would say the answer to that question is yes. All right, so we are reaching the time for a break. We're going to take a 10-minute break, and keep the questions coming either through the chat box or through YouTube, and we'll keep answering those questions. Thank you very much.
Hello, welcome back, everyone. We are now moving on to our second half with our new distinguished panel joining us. I will now welcome our first presenter, Karen Telschow Johnson of Telschow Johnson Law.
Great, thank you so much. Thank you everyone for being here this morning. So we're here to talk about advanced care planning for seniors. So first of all, who's a senior? Anyone over 65? I'm a little bit, about 10 years shy of that. So anyone over 65, but advanced care planning is really for anybody who cares enough to plan in advance for what your healthcare wishes are. So that's what healthcare planning and advanced care planning are. And you just need to be over 18. So what are the aspects of advanced care planning that we should think about? Importantly, advanced care planning is not just do we pull the plug or do we not pull the plug at the end of life. It doesn't happen that way. Our bodies unfortunately fail at a gradation level, right? So it is very rare that at any point in time somebody's going to end up in an emergency room on a machine and then a family has to decide to pull the plug. Instead, what we're looking at is how do you want to be treated at the end of life? So what do your last best days look like? So as you could probably tell in this very short period of time, I like to talk. So if I can't talk, if I can't verbally communicate, that's going to be an issue for me. I need to be able to do that. I don't need to be able to run a marathon. God bless those who do. I don't need to be able to, to compete in any, tennis marathon at all. And so, but what I need to be able to do is communicate. So what's important to you? And it's important that your advanced care planning wishes really respect that. So it is rare, again, that we end up at that very life and death moment. But when and if that happens, we want our dignity to be maintained. That's what we're looking for. And so what respects you, your wishes, and your dignity? But importantly, in the state of Texas, what governs advanced care planning here? And so we have documents that govern advanced care planning. When there are no documents, there are statutes that govern who gets to make healthcare decisions for us. Particularly in Texas, it's the Texas Health and Safety Code, and it's provision 313.004. Write that down, put it in your phone. So if you're in a hospital and somebody says, you don't have a medical power of attorney, say, hey, there's a statute that governs who gets to make decisions, and I'm one of these people. So in that statute, I think it's important for you to know that the first person who gets to make decisions for you is your spouse. The second person who gets to make decisions for you is an adult child who has the consent of all of the other children. That's key. And then the third is the majority of available adult children. The fourth is the parent of the patient. And then the fifth is an individual identified to act before the patient became incapacitated, or a nearest living relative or clergy. And by nearest living relative, we're not talking about consanguinity. We're not talking about a brother versus an aunt and who has that type of decision-making authority. We're talking about physical distance. And God bless my folks who are less than a mile from me, but they know they cannot make any healthcare decisions for me. And so you need to have in writing who would make healthcare decisions for you, and that's important for the medical power of attorney, which we'll discuss a little bit later on. A hospital and a care facility also have procedures in place. They'll have do not resuscitate order procedures. Those aren't statutory documents. Those are procedures within their hospital systems. And last but not least, what everybody tries to avoid is a judge having to make a decision via a litigation process, because when you're suffering with health issues, the last place you really want to be is in a courtroom. And so what are the statutory documents to control advanced care planning in our state? Well, we have the medical power of attorney, and that's an appointment of a healthcare agent, and you'll see later on the initials MPOA. The directive to physicians and or family surrogates, the Health Insurance Portability and Accountability Act. You hear about that document all the time. Who has your HIPAA? Who has the HIPAA? Where's the HIPAA document? The HIPAA document is the document that allows whoever holds it for you to have access to your medical information. You don't have access without it. The out-of-hospital DNR order is also a statutory form. It is signed by a physician and the patient pursuant to a particular diagnosis. So not everybody can just have an OOH DNR. And written medical decisions can be revoked or changed orally. So if you go in the hospital and you've got somebody on your medical power of attorney and you guys have just been in a huge fight, well, guess what? You can say, I don't want that person, you know, you and your spouse. We just got in a huge battle. No, I want my sister on it, and that's who I'm gonna have make medical decisions for me. They write that in your medical chart, and that's what will prevail. And so let's go to particulars. When is the medical power of attorney effective? It's effective when you cannot communicate. You're literally, you know, so go to number 3 there, you're unconscious. Or your communication is ineffective. How are you doing today? And you answer, purple, floor, you're having a stroke. You're having a traumatic brain injury. And so what do physicians look at whether or not somebody can communicate? It's important for you to understand this. There's generally 4 abilities that must be present for an individual to have mental capacity, right? So when a physician asks you some of these questions, you actually know what they're looking for. They're looking for your ability to understand information given to them about a particular diagnosis. They're asking about your ability to retain the information, right, for longer than, you know, a few minutes, so that you can then have a conversation about the information you're being given, your ability to be able to weigh and evaluate that information, and the ability to communicate the decision. And so this is what physicians are looking at in a hospital as to whether or not you have the ability to be able to make your own medical decisions, or if the medical power of attorney document is now effective, stating that these are the people who can do that for you at that time. And so when you have your adult children on there, I like to have this conversation. It is important for you to understand that while you're in their presence, they are going to be so sweet to you. And that when these kids go out of the room, that's what they're going to be battling each other as to who gets to make that decision, all right? And so it is important. I am not a fan of co-agents on these documents. I have 3 kids. They're all wonderful. At the end of the day, if they can't agree, it has to go to court. And as much as I know Judge Allen loves her job, she does not want these battles in her courtroom, because these are very much family issues that need to stay in the family. And so when you're thinking about who to put as a medical power of attorney, please consider alternative agents. So the directive to physicians and family surrogates. When is it effective? It's effective if you're in a terminal or an irreversible condition, and you've been qualified by a physician as being at the end of life, and you're on machines and you can't communicate for yourself, and so this document in particular communicates for you. But this document is limited. So when we're talking about a terminal condition, it's complications usually due to cancer. And when you're talking about an irreversible condition, you're talking about complications usually due to Alzheimer's, usually due to Parkinson's, and now even due to COVID. All right, and so it's important to understand that this document is effective at the end of life. It means we are not being cured of anything, because we can no longer be cured of whatever is happening to our body that puts us at the end of life. And so let's talk about COVID. This is on everybody's mind, right? And so if I go on a respirator, right, and that's not the first line of treatment by any far stretch of the imaginations, but that's everybody's concern. I'm going to get put on a respirator, and then I'm never going to come off of that. The respirator is used as a treatment modality to help you breathe, right, to help you recover from the virus. And so if you go on a respirator and your body is recovering, we're in curative mode, then the directive is not effective. That pull the plug, it's not effective. But when you're on a respirator and at some point your liver fails, your kidney fails, your skin models, your hands and feet start curling, that's the body at the end of life. And that's when a physician will write in the chart that specifically that your body's at the end of life. We need to know what the patient wants at the end of life. The medical power of attorney can see to it that treatments are followed, but they also have to see to it that the directive is followed. What they cannot do is they cannot change the directive. And so it's important to know that when you give somebody the medical power of attorney, you're not giving them the right to pull the plug. You're giving them the right to follow your wishes and what you would want. And so the more that you have in writing, the better. There are other documents and procedures that guide medical staff in advanced care planning. One of those most common is a Texas Medical Order for Scope of Treatment form. It's the most form. It is not a statutory form at this time, But even me, I went in a year or so ago, had a gallbladder procedure, and they were like, here's the MOST form. Why don't you read that and fill it out? And I'm like, really? It's a medical order for scope of treatment at the end of life. It's regarding CPR. It's regarding a number of other things we'll go over in a few minutes. But it is a form that you can find online. Just put a Texas MOST form. And every single hospital system, Baylor, Scott and White, THR, has this form, and when you go in for a medical procedure, they want you to review it. Because I don't think that any client or patient should be surprised at a hospital setting, I think it's important for everybody to review that document. Also, the 5 wishes document is a document that says that if I'm at the end of my life, these are more specifics into how I want to be treated. Remember how I said that the Texas form really has that check this box or check that box, right? Pull the plug or keep me comfortable. 5 wishes goes into that gradation, right? So it goes into, do I want artificial nutrition and hydration? Do I have religious perspectives that I want to be taken into consideration? So even in my directive, there's a form, a part in the form with lines where you can put specific instructions, and I have in mind, please see 5 wishes attached. And at the back, then I have my 5 wishes document that goes into more detail as to what I want at the end of my life. And then there are do not resuscitate hospital and facility protocols that are not a statutory form, but protocols that they have to follow regarding notice and information to patients and families, specifically relating to do not resuscitate orders. But since we've been talking about, some pretty serious stuff, I do need you to know that lawyers can do a lot of things, but we can't cure the virus, right? And so it says your body isn't responding to traditional medicine, so we're bringing in an attorney to sue the virus. Well, I appreciate that, but I can't stop COVID yet, but that is wishful thinking, so thank you, because more and more people have come up to me, can't you just stop that? And I'm like, yeah, a TRO, a restraining order, is not going to help with that one. So a little bit more detail about the MOST form, because again, I think it's important that people not be surprised when they go into a hospital. It's not a statutory form. It must be signed by a physician. It's pursuant to some sort of medical treatment and diagnosis that you're receiving. It does go into specifics as to whether or not you want to be resuscitated, and talks about the real pragmatic application of, unfortunately, of CPR is not what we see on television. It's not you stop breathing, they do CPR, you come back to life. No, there's a 70% failure rate with CPR, and so that's a serious conversation to have if you have that concern. And then the scope of your medical intervention. Do you want broad support, do everything, or do you just want to be kept comfortable? Documented basis, it specifically asks, do you have a medical power of attorney? And so these are important things for the MOST form that hospitals are using more today. And so the 5 wishes document, again, the first part, wish 1, is specifically stating who your medical power of attorney is. Texas has a statutory form for that, and so wish 1 really isn't applicable in our state. But the website for this 5 wishes document that is effective in 44 states, and if you've used it in another document and executed in one of those 44 states and it's brought into Texas, it's a legally valid document, but at minimum, it provides instructions to people treating you as to what you want. That's 5wishes.org for that document. It is important to put things in writing. That may be going a little bit overboard. And it's a lot less painful just to put things on paper. But there have been a few lawsuits, and particularly dealing with this issue. And in one case, they found it effective, and another case, they found it not effective. These are state laws. And so each state has its own cases relating to these issues. So, but a medical power of attorney in these documents that are validly effective in another state are effective in Texas. It's just that Texas does, like any other state, Texas prefers its own forms. And so the future ahead, MOST has been proposed in the last 2 legislative sessions, and the 5 wishes document has been proposed, or form of it has been proposed in the last 2 legislative sessions, and we're going to be effectuating those discussions again. And so this is what we hope. The idea is to die young as late as possible, right? And I know we're all challenged with that in these times, but that is our hope. And my name is Karen Telshaw Johnson. I am chair of the board of directors for the Alzheimer's Association. I'm very proud to be a part of this organization. That Leon also, Polk also serves with me on the board, and we are very grateful to have him. And we've been up to DC a few times to try and help get the laws changed to address these issues. Really appreciate your time today. Thank you so much.
Thank you so very much. It's very helpful information, Karen. We'll move on now to the Honorable Brooke Allen of Tarrant County Probate Court 2.
Thank you, and thank you, Commissioner Brooks, for putting this on. I'm glad to be here. I have the task of talking about the confronting growing problem of elder abuse. And I think I'm going to overlap with Karen a little bit, and also with Lori, who you'll hear from after me. So I'm going to tell you a little bit about what our courts do, the statutory probate courts. And in doing so, we're going to talk about some statistics, what's going on right now, which I think is very concerning, and then also how we can help prevent that. So let's see, how do I get my PowerPoint on? I know how to advance it. There we go. All right, I said thank you, seniors and retirees. I understand there's lots of you who aren't seniors or retirees yet. And thank you to Tarrant County, of course, and the Alzheimer's Association. Before I get to the next thing, I wanted to share some statistics I had. So in 2018, there was 12% across Texas of people who were 65 and older that there was a concern or confirmed elder abuse. So that's 12% across Texas. In Tarrant County in 2019, there were 35,000 APS investigations. So that's Adult Protective Services, anybody who's over 18. Instead of calling CPS, Child Protective Services, you would call APS. And 35,000 investigations and about 3.9% abuse. I shudder to see what's going to go on for 2020. And I am going to encourage all of you right now to go see your loved ones. My grandmother is 94 years old. She is in a memory care, and I have not seen her in person since March. I used to go to church with her every Sunday at her memory care facility. I have seen her through the window, and I have seen her through the door, and her face lights up when we see her. So I understand you can't go and actually see your people right now, your loved ones, but you need to do what you can. Make the nurses get on FaceTime and provide an iPad. Make them bring your loved one to the window, to the door. I know it's hot outside. Spend that time. Go and get in the car, and if you can only wave to them from the front door in the car, go do it. We have so many great care facilities out there, but not all of them are great. Or not, it's not necessarily the facility, it just takes one person. And unfortunately, when we shut our loved ones out, we are making a prescription for abuse. I have 3 social workers that work for me in probate court 2. Their job is to go visit all the people who are under guardianship, and then also visit people who a potential guardianship might be needed. We have tried to respect the laws and the policies of the care facilities and group homes, but I have told my social workers, if there is one inkling of abuse, we will go in. And if that means taking Sheriff Wayborn with us, I've got his cell phone and I know he'll be there. You guys are the best people to prevent abuse. So please, please get in there. That's my soapbox. My grandmother is, like I said, 94. They've told us stay out, it will prevent COVID. Well, she got COVID. She was at Baylor Hospital, and she was released, but she can't go back to her memory care facility because she's still positive, even though she's doing well. So now she's at another care facility that we can't visit. So now she's at a facility that we've never actually been inside. But I know that my sister was there last night visiting her through the window. Again, however you can get in there. Hospitals have policies of no visitors for COVID, but they have exceptions to those policies. Make them follow their own written exceptions. Get in to see your loved ones. It's so important right now that we keep an eye on those people. Oh, thank you, Roy Brooks. All right, that was my soapbox. I'm going to get into a little bit more about what our court does, which will help you prevent abuse or stop it if you know it's going on. A lot of what we do are decedents' estates. Obviously, you want to, what did you say, die young as late as possible. But if you do die, I hope that you have a will. It will make it easier. You can, if you don't have a will, you can do sometimes a small estate affidavit. You don't want to do a dependent administration. I can promise you that taking some time and getting documents in place now will save your family thousands of dollars on a dependent administration where you've got to come ask me to pay your attorney, to sell your house, to do everything. You don't want to be there. Testate matters. That means you had a will, you took that time, and you met with an attorney and got those documents in place. Sometimes you can do a muniment of title, just a quick, I think 10 questions in front of the judge and you're on your way. An independent administration, again, few questions, you're pretty much on your way. You've got to file a couple things with the court. Or again, if your people are fighting, you might find yourself in a dependent administration. But most important today is I'm going to echo what Karen said. You need to have in place for yourself and your loved ones all of these documents: the durable power of attorney, medical power of attorney, physician's directive, and a designation of guardianship. We're going to get into this in a minute as far as what is guardianship and when it might be needed to help combat elder abuse or exploitation. But when you're doing that designation of guardian, not only who you want to serve, who you do not want to serve. So you might have that kid out there that is a great kid, but he might pull the plug maybe a little too early. Well, we're going to say we don't want that person as our guardian of the person. Now, he might be great for a guardian of the estate over your financial things, but you may want to say, no, I don't want him making the guardian of the person or the medical decisions for you. And also, one of my social workers wanted me to mention, she's seen a lot of spouses that have separate bank accounts. Well, when you have a separate bank account, if wife is incapacitated or can't make those payments, bank is not going to talk to husband because it's a separate bank account. So then you're looking at needing those powers of attorneys and those types of things in order so that you can pay for her care. All right, guardianship. So you can read the Texas Guardianship Association definition of guardianship. And what I'll tell you is what guardianship is and what it's not. Some people think that guardianship is like child custody. I go into court, I get custody over my loved ones, and it's bye-bye, see you later. It is absolutely not. It is court supervised. So when I talked about a dependent administration, that's very similar to what a guardianship is. If someone is under guardianship, then the person who I've delegated the authority to, the guardian of the person or the guardian of the estate, is going to have to come to court and ask to make decisions. That's not all the decisions. Now, they're going to be able to make medical decisions without asking me and those types of things. But they're also going to have our social workers coming to visit them at least once a year. They're going to have to file a report with me. I read all of those reports personally, and I can tell you I will follow up. That's why, again, we have 3 social workers. We have 1,300 people under guardianship, and so we obviously need that staff to make sure that those people are okay and also deal with the things that are coming in. I'm going to tell you 2 stories. One was about a gentleman, and he said I could share this, which is kind of giving away some of the story. So this was the 3rd day on my job, and I came into court. We had a temporary guardianship, and this gentleman was in a coma, and his mom wanted to do one thing. The hospital had had their ethics committee meet and wanted to do another thing. And then his brothers wanted to do a third thing. So we've got 3 different opinions here that really tie back to what Karen said. We had some hospital policies going on. We had the Health and Safety Code 313 that was at issue because we had a parent and then we had some brothers, but nobody could get along. So here they are in litigation wanting a guardianship over this gentleman who's in a coma. So we go into the hearing, and everyone who is a proposed person under guardianship has to have a court-appointed attorney. So the court-appointed attorney walks in, and she's ready to go, and she says, "Your Honor, I walked into the hospital room just to meet with my client, not expecting him to be responsive, and he was awake." Wow, this is good news. Okay, so we have our hearing. I hear from Mom, and I hear from the 2 brothers. Well, the one brother that was willing to serve for guardianship had a felony. And he also said, well, you know, I'm just going to pull the plug. My brother wouldn't want to live this way. So you're disqualified with a felony. And then I'm thinking, he was actually testifying he wouldn't even consider what the doctor said. He was just going to pull the plug. Okay, again, it's like Karen said, these are not the cases that are easy that are in my court. So this is a decision I have to make. Well, the second brother did not have a felony. He at least said he would consider what the doctors were saying. And also we had a person who was awake now, so we had a little bit different situation. So I appointed the second brother, and 2 weeks later, this gentleman walked out of the hospital against doctor's orders. 2 months later, he walked into my courtroom to say thank you. His wishes were to essentially be in a coma on life support for 6 months to a year before the plug was pulled. And I looked at him and I said, you need to thank your brother. You need to articulate these things to your brother. And you are a competent person. You need to sign a power of attorney. As soon as you leave my office, please go to an attorney's office and get those documents signed. He actually was in a motorcycle accident, and like half his brain was lost and stuff. And of course I asked him if I could share his story, and he said, yes, please do. So these are the types of things that we're hearing. But if these documents are in place, he could have said, I want this brother to make decisions. The hospital would have looked at that brother, and even though Mom was upset, it would have given that brother a lot more power, like I had to give the brother after litigation. The other one concerns something that's going on right now, where someone comes in and they have early onset, so they understand some things that are going on. They usually still want their freedom, and I do not blame them one bit for that. And they want to go home. But the person who's at home is no longer willing to take care of them. So in these times, I'm put in a position of, we've got to find another family member to take this person in, or my only option is to put them in a care facility. A care facility where they can no longer see their loved ones. And they have early Alzheimer's, so they don't necessarily understand what's going on. That's a problem. All right, I've got 2 minutes. So I'm going to tell you, if you want guardianship over a loved one, it's a very high burden. It's clear and convincing evidence. That's a firm conviction or belief. That's almost beyond a reasonable doubt as our criminal. Most civil is going to be tip the scales just 51%. So clear and convincing is going to be higher than most civil, but below criminal. And you also have to prove that all these alternatives we've been talking about today are not feasible. And you'll see some of the statutes and things we've talked about. All right, we also talked about being under guardianship. So most of the time that your loved one is losing their rights, their fundamental civil liberties. That's why we've got clear and convincing evidence that's required. That's voting, marriage, driving, where they're going to live, all of those things. We also have a public probate administrator, but that's after you've passed away. So I'm going to skip that a little bit and look through my notes and see if there's anything else. But here's the best way to prevent abuse. It's you guys out there taking care of your loved ones. Even if you can't be in those facilities right now, I was able to get my grandmother's Bible out of the memory care and take that up to the hospital, and then I delivered an iPad to the hospital. Do those things, send some pictures, let people know that this person is loved and this person is being watched. Even if I can't get in, I am going to be there, and I'm going to be watching them, and I'm going to be advocating for them the best way I can. Thank y'all, and I will be back for questions.
Thank you so much, Judge Allen. Just a reminder to our audience to send us your questions in your chat box. We'll come to Q&A soon, but right now we welcome Ms. Lori Varnell, Elder Financial Fraud Chief with Tarrant County Criminal District Attorney's Office.
Good morning. So glad to be here with you all. I'm gonna launch into a little bit of what we're doing at the DA's office, what we're seeing, because I think the best way to prevent elder financial fraud is to know what's happening. And so the more you know, the more you can watch out for potential scammers that are coming at you. One of the things that we see all the time at the DA's office, the most common offender, is our own kids. And like Judge Allen was talking about, maybe you've got 3 or 4 kids. I normally ask, like, how many have more than one kid? And then the next question is, and all of you love your children the same, you love them equally? Yes. But there's that one kid that you know that you're like, you might steal from me. That is not the kid that you want to designate as your power of attorney. And so, but who ends up doing that, right? Well, it's this guy on your screen there. It's a son of a widowed mother in his late 30s or 40s, living at home after divorce or jail. And he's usually got a drug, alcohol, or gambling problem and steals from mom in order to feed it. He's also the one who has time to take care of mom, right? Because he's not employed. That is the most common offender. And so there you go. That's number one. So again, those documents are so important. I don't know, this is the 3rd speaker that we're listening to say that to you. Make sure you have that power of attorney. That's where this son will get most of his power, and make sure it's limited. You do not want to give someone else the ability to gift your property. That is not a good idea. If you want to keep giving to some specific cause, then find another legal way to do it than a power of attorney having that much discretion. So very important, those documents. The second most common offender that I see at the DA's office is a hired caregiver. So where are these offenders being hired from? Well, a lot of times they come from Craigslist, or they can come a family of a friend, and the bottom line is you do not want to hire one person to take care of your loved one and then walk away. You need to stay involved. That is the most important thing anyone up here has said, is stay involved with your family. And no one is going to love or care for your mom or your dad like you will. And so you make sure you stay involved with them, and that is the biggest way to prevent them from falling victim. Another thing that I like to do is have very frequent conversations with my mom, which I have the ability to do because she lives across the living room from me. And so in our spare time, I make sure she understands that we don't pay people to be our friends. And I'll tell you, I'm going to show you what that's the next most common offender, is organized criminals, okay? Organized criminals are coming at you in your face and on your computer, in your email, or over your phone. They're constant. This is all they do. That is their job. You are a target. If you don't know that, you need to know that. There are people who are looking for you. Once you get your AARP card, you become a target. And sadly, a lot of us up here got them not too long ago, right? So, I mean, we're all getting there. But these folks will come at you, and if you are someone who tends to be very trusting, as people in the greatest generation a lot of times are, because you grew up with I'm going to treat others how I want to be treated, number one. And number two, I want to do something that helps our society. I'm going to do things that help people. And so the greatest society, who's very trusting, very giving, very community-minded, has now become the most exploited of anybody in any group in our community. And so what we want to make sure that we're doing is we're also being very wary of the scams that are coming at us. So just to give you just a slight idea of what we're seeing is it is organized, okay? You've got your gypsies and your those folks in Canada. That's what I call the GMA scam, the grandma scam, okay? That's the one where they call you up, hi grandma, this is your grandson, I'm in jail, send me bail money. And then they will talk you into wire transferring money. Unless it is the purchase of a house, you should not be wire transferring money anywhere. Buying Western Union, going to MoneyGram, buying Green Dot cards or iTunes cards. You should not be buying those things. That is the hallmark of these scams, is that turns into cash money instantly, and it is gone, and you will never get it back. And there is a concerted effort worldwide to get you send your money out of the United States. So those are coming from Canada. Then you have the fake Geek Squad, Microsoft, Apple, those sorts of scams where your computer now has a virus and they have to fix it, and you have to let them access your computer remotely, and then the fun begins because now they probably can access your bank account, etc. So those are all coming out of India. And then the third group of online organized scammers, also it could be on your telephone or by mail, are the Facebook boyfriends, foreign princes that have money they need to bring to the United States, fake government agencies like the CIA has a warrant for you, or we're about to take your house from the IRS, and those sorts of government impersonators. So this is something I say, this is no offense to anybody who works at any government agency, but how hard is it to actually speak to a human being at Social Security? They're not calling you. So if you're getting a call from someone who claims to be from Medicare or Social Security, that should be waving red flags at you, because that's not how they work. You normally have to go up there to that horrible lobby and sit in the hard plastic chairs and take a number. That's how Social Security and Medicare work. They're not just monitoring your account to give you a call up, okay? So don't talk to anybody on the phone who pretends to work for a government agency. Government agencies will do what I call letter you to death, okay? You're gonna get a ton of letters if you've messed up with the IRS before you ever see anybody on your doorstep. And the IRS does not have criminal authority to come and get you. It would have to be somebody that does. So just make sure you understand that. Those are the common, and that's a broad overview of the common organized online, telephone, and email scams that we see going on at the DA's office. So we talked about the government pretenders, the jury duty scam. Tarrant County does not arrest people for jury duty, and as far as I know, I've never seen anybody get a fine because you missed one setting of a jury duty. So that's all not going to happen most of the time, and in fact, you will not be arrested for failing to pay property taxes. That's also not true, okay? And so we've also got the Geek Squad or the Microsoft, so remember that you don't want to give anyone else access to your passwords or anything that would allow them to get to your money, including your Social Security number. So we've talked about that. We've talked about the grandma scam. I want to mention briefly the Bitcoin and loan scam. Bitcoin scams are basically fake investments, and try the Warren Buffett method. If you don't understand Bitcoin, you should not be participating in Bitcoin. And while I'm at it, I'm going to say if you didn't play the Canadian lottery or the Ohio lottery or the Maine lottery, you did not win those lotteries, okay? There are no free entries for lotteries, okay? Also, If you have to pay someone to get a loan, you should be very suspicious. Unless it's a house deal and you're paying points, most of the time when you need to get a loan, it means you don't have money to pay for it. So if you're paying $500 to get $10,000, that's probably a scam. And then there's also the email fraud, where you get an email that looks like it's from your bank. As you notice, I have many major banks here, not picking on any of them, but you can actually just pick up their information online. So here's why I talked to my mom about paying to people to be friends. My dad passed away in 2010, so she's been alone for 10 years now. And a lot of folks have a very hard time dealing with that. And so they go out, they've never been on, they don't understand really, and they get on Match, or they get on Our Time, or Plenty of Fish, or any of these, farmersonly.com. They get on these sites and they meet someone who love bombs them. And what I mean by love bomb is all of a sudden you are the earth and the moon to them. They're usually a little younger than you are, or they pretend to be in the military, or they pretend to be sending you a chest of gold, and then all of a sudden you are out getting your first payday loan or second mortgage on your house in order to send them money. These people are what we call catfishers. Those folks are coming mostly out of Nigeria, and if you have a Facebook or any other kind of boyfriend that is online, do not send that money. Seniors are literally transferring their entire fortune, their entire retirement overseas to get this chest of gold or a box of money, and it is all a scam. The money's gone and we'll never get it back. So please listen to that. And remember what I always tell my mom, we don't pay people to be our friends, they pay us. All right, this is a Facebook boyfriend. Here he is. He got $1 million out of one of our elderly ladies out of Tarrant County, Northeast Tarrant County, $1 million, and the last $10,000 she borrowed. So just know, there is a worldwide concerted effort to steal the retirement funds of this country. Stop feeding it, please. What about face-to-facers? What do we got there? Well, what do all these things have in common? This is where retired folks hang out during the day, right? And they know it. So when you're in a place like this, you might want to just be wary of someone who's coming up to you and approaching you. Sometimes they just drive, and sometimes you can tell where the elderly person lives because there's handicap accessible ramps, or my most hated way that they know is they know you're a retired veteran if you have a flag in front of your home. So here is a door knock that occurs, and I will tell you, I don't know that this is going to play. I'm going to try though. I want you to listen to what this person tells the victim standing at the door. She's elderly. Whoops, or not. Let me see if I can make it work here. Can you make it click?
Wires for their cable, and I might have to be in your yard. That's the only thing I'm telling you. If I can get your attention for 1 second, please. It's all it's gonna take me 1 second, just to show you what I'm doing. Yeah, I'll meet you around back. Thank you.
Okay, so what you see is a person with a yellow jacket. Looks like he's doing some sort of work. He has also a walkie-talkie. What happens next is this doorbell shows someone else coming in her front door and taking all of the jewelry. Do not come out of your house for someone who knocks on your door. Insist on seeing some sort of an ID badge, and don't just assume that they're legitimate because they're wearing a yellow construction vest. Finally, we're seeing investment fraud. So if you have someone who's telling you, They will pay the taxes for you to take your money out of your IRA, or if you have someone who's telling you there's zero risk or a guaranteed return, those are huge red flags. If Wall Street could get that sort of an investment, there would not be one penny left investing in companies. So if you look at this, this is what someone's promising you on the right side of the screen. Sadly, the left side of the screen is what the actual stock market looks like. So you can see that that promise there is what Bertie Madoff made, okay? Zero risk, and guaranteed return. Anybody can make that up, okay? That is the art of the con. So what do? Call police sooner than later, call APS. Don't throw good money after bad. You're not gonna get that chest of gold with another $1,000. It's better to tell and be embarrassed than to keep silent and stay victimized, because shame always has to have secrecy to fester. Please trust law enforcement, and if you can't get somebody to listen to you there, tell them they're needing to call me or call the Financial Exploitation Center. They are also a great resource if you've been exploited or you think you might be being exploited. They can step in and take steps to help you. There's your local police department, Adult Protective Services phone number, and the FEPC. Those are great resources for you. And then finally, there's Sharon Wilson. She created my unit, your district attorney. We thank you so much. Please let us know how we can help the police start investigating these crimes and start working them.
Thank you so much. Thank you for those very important warnings. We turn now to Ms. Gail Snyder, the Executive Director for Dementia-friendly Fort Worth.
Good morning, everyone. I'm delighted to be here. Thank you, Commissioner Roy Brooks and Leon Polk, for the opportunity to participate in this great event. So, I have the privilege of talking to you about something that might be considered a little bit more upbeat to end off our session today, because what I want to tell you is about how we can become a better dementia-friendly community. A dementia-friendly community is one that provides a safe and respectful environment for those who live with Alzheimer's and the many types of dementia that are out there. And Dementia-friendly Fort Worth is working to help individuals understand what dementia is and to bring education to the businesses in our community. We're collaborating with many community partners to advocate for systems change and to provide education and resources and services that enhance the lives of those living with dementia. Sorry, my presentation isn't advancing. There we go. So what I want to tell you about a little bit today is what we have changed because of COVID-19 and the pandemic. Everybody's work has changed in this new environment, and right now it seems a little bit more difficult to help businesses understand what it's like to be dementia-friendly, because they're not seeing the patrons that they were seeing prior to COVID-19. So what we've done is we have changed some existing programs. We have a weekly chapel service that was an in-person event that happened every week. That is now an online event and can be viewed on demand through a YouTube channel, and it also is offered as a live event every Sunday afternoon at 2 o'clock. We also already had a program called the 5th Street Cafe, which is a dementia-friendly social club, and it was meeting in person 2 Wednesdays a month, and that program has also moved to a virtual platform and meets every Wednesday from 11:15 to 12:15. And there's just the graphic. If these presentations being sent out where they'll be able to click on the links? So the link is there where you can go see the ones that have already been posted, and then you can see the link there to visit the live event on Sundays at 2 o'clock. And then this is the link for our 5th Street Cafe. We've also created some new programs to help individuals who are living with dementia and their care partners. Through some of our collaborations and partnerships within the community, on April the 27th, we launched a brand new program called Activities for People Living at Home with Dementia. And I have to say that when we first launched this program, I was a little bit overwhelmed because I'm not an activities director by skill, but it's one of the favorite things that I get to do now because we have an opportunity to build relationships with people who are living with dementia. And the program says people living at home, but it can be someone living in an independent living community, an assisted living community, and even a memory care community if my PowerPoint keeps advancing when I'm not ready for it to. Even when you can't see them, there are ways for them to have socialization and activities, which is very important. Another program that we do is we collaborate with other community partners to provide educational events that provide resources and connections for care partners and professionals in the area. Providing person-centered care is paramount for people who are living with dementia, especially in this time of great isolation. Depression and an overall decline in health has been seen during this time because of the isolation and the lack of connection. Person-to-person connections are so important to all of us, but for people who are declining because their brain is dying, it's even more important to continue those connections. These factors are already present, but in these times of social isolation, the problem is greater. These slides just give you some information about the programs. The logo that you see is the branding for this program. So we have Facebook posts that go out about this, and we also have an email that goes out every day to remind individuals about the program, and you can click to enter the program from that link. Please feel free to share this with family members and other professionals who have clients that can benefit from this program. Karen and I were talking just before the presentation, and she is on our email list and receives the emails every day, and she forwards them to clients and family members that can take advantage of this. Things that are involved in this program are art appreciation, baking, bingo, brain and mind stimulation, crafts, exercise and movement, games like Jeopardy and The Price is Right, music appreciation, and sing-alongs. So we don't do the same thing every day because our brains and our bodies need different types of activities, and so we change it up. These are just some of the community partners that we've worked with to make this partnership successful, and we could not have done this program for this length of time without their help, and we are making plans to continue this program through the end of the year. One of the new partnerships that we launched in July is a partnership with Amon Carter Museum of American Art and the Artful Moments program, which was formerly an in-person program at the museum, and now they're with us one day a week for an art appreciation on various themes and subjects. And the participants in the program really love this, and some of our participants have come to the program just because of the art program. We also have a new partnership with Texas Winds Musical Outreach, and each week we have a music concert. And these two programs that I've just mentioned are great ones that communities can make available to a large group of participants. Even though they live in a community, they can still participate in these events. This is a sample of some of our baking classes that we've done. About every 2 weeks, we do a class called Cookie Conversations, and I bake cookies, and we talk about the smells of cookies and what it tastes like, and just talk about different memories that they have about cooking and baking and favorite foods. And early on, we talked about, it would be really great if they could smell what I was smelling in the kitchen. And that wasn't possible because we don't have that kind of technology these days. But I decided to send out a box of cookies to each of the participants who joined the session that day. And now, if we don't have one on the schedule, they say, when are we going to do cookies again? Because it's really their favorite part. And then they text me or email and say, I got my cookies today. And they're just so excited. But what I really love about this program is that it is a non-judgmental atmosphere where they have opportunities to voice their ideas and their opinions at whatever level they're at. They also have friendships and relationships with the other people in the group that they might not be able to have even if we had an in-person event, because it happens every day. They are engaged in various activities that engage multiple parts of the brain, the memory, executive functioning, their attention, language, and visual spatial. And I've been amazed to see how some of them have connected. Early on, we had a woman who was in the program, and she's more advanced in her dementia. And at first, she just sat back in her chair, and she didn't really participate, and she didn't really smile, and she didn't really respond. But as her family helped her to get onto the program multiple times, she would start to smile when I would address her by name, and she would start to respond to some of the questions when we would address those directly to her. We also have been encouraged to see just how faithful they are to come, because it's like it's on their schedule, and they look forward to coming. It's their time, it's their space, and they are very appreciative of that program. What can you do as a family member or a care partner? This slide gives you some information. Be aware of what dementia is and seek to be educated about it. Find ways to advocate for better services, and everybody who's spoken before me has talked about some of those ways. Learn how to respond with empathy and compassion. Many times our response is because we don't understand something, and if we have a better understanding of what dementia is, why they are responding, because maybe they're fearful, they're frightened, they are lost, we can help to have better positive outcomes if we just understand what they're dealing with. You also have the opportunity to encourage businesses that you frequent to look into the process of becoming a dementia-friendly certified business. And I've provided the links there that you're free to share, also with a list of the types of businesses that we have. Some of those businesses are represented here today on your panel. And there's a link where you can find the list of those businesses on our website at dffw.org, and also on the City of Fort Worth website at Age Friendly Fort Worth. Thank you so much for the opportunity to share today. And again, the programs that we are providing are here to provide socialization and interaction to help you meet that need for your family members that maybe you can't meet in person. But it also provides a great opportunity, because since this is Zoom, even if you can't be in the physical space where your family member is, you could join them on the Zoom event from your location and from their location. Thank you again for the opportunity to share.
Thank you very much, Gail. Thank you also to the rest of our distinguished panel. We will now move on to questions from our audience, and just a reminder that you can enter your questions into the chat box. We've received quite a few, and we'll start with Gail. We received a question. What if the Alzheimer's patient has never really been socially involved, always has been quite a loner? What can I do to get him out of the house and just go for a walk?
I think a lot of times the thing is that they need encouragement, and with dementia, sometimes they may be more willing to do something that they wouldn't do before. Make some suggestions about something that's their favorite. If you know they love ice cream, go for ice cream. If you know they used to love to bake, suggest that they watch one of the baking sessions on our activities program. But we have to be creative. It's kind of like being the parent to a toddler, where it takes work on our part to keep them engaged, to keep them out of trouble, and to discipline them. So be creative, and don't be afraid to try something new. Even if your family member doesn't like to get out, you can use photo albums or coffee table books of art or certain other things that they've enjoyed, just to spend time with them.
Thank you. Empathy is very important, as you've said, and you work with a lot of caregivers. What are you learning are some of the biggest challenges for caregivers who are at home now that we are 5 months into COVID-19?
One of the biggest things that I see is the caregivers who are trying to continue to work from home and find opportunities to engage their loved ones in activities so that they can work. And many of them, we see through the program, have a caregiver that's there in addition to them being at home, because they can't manage keeping their family member occupied and engaged in activity and get their work done. So that's a big stressor. But this program also provides an opportunity that for that 30 to 35 minutes, if they get that person engaged, then it does give them a little bit of a break, because we have a couple that participate, and the husband gets her set up on the program, and then he leaves the room and he goes to do something else. So it frees him up to take care of something else that he might not be able to do if she didn't have an activity to engage her.
Thank you very much. Ms. Farnell, we've had some questions related to your presentation on elder financial fraud. This first one is related to receiving unwanted mail and making friends online. Where can I report irritating emails related to sex? It's so irritating and I can't stop it.
Well, one of the things that I have done for my mom is I just got rid of an old email address and created a completely new one. And they're free for Gmail accounts. You can just get one for free. And I would just shut down your email address and tell your friends, here's my new one. And if you don't have to change the first part of it. You can keep this, more than likely you can probably have the same email at gmail.com or some other free provider, but just get a different email address. There's really no way to stop email from coming into your account. I know I hate those emails myself, and I push stop, and unfortunately the actual responding to the email can sometimes make them, if they're scammers, they'll send you more. So if you've been trying to stop it, very likely you're getting spread around as somebody's actually looking at those emails. So I would suggest you just get a whole new email box. They're free, and that way you don't have to spend the time sorting through it. And that's one of the things that I think happens with folks that have dementia, is they're used to having to deal with every stimulus that comes to their house, every stimulus that comes in their mailbox, and every stimulus that comes in their email box. I have to do something with that. And a lot of times it gives them a lot more peace to remove that stimulus. And so just get a clean slate. Same thing with door knocks. It's very hard to keep someone with dementia from going to the door to meet the guy I showed. So those sorts of things, removing that sort of a stimulus, can give them a lot more peace, and then they actually can find and get to the email they actually want to see.
Thank you. This is a related question. Being online and communicating through social media is so important to so many people who are having to practice social distancing. Are there ways that we can continue online activities and social media without increasing our risk of fraud?
So one of the best ways that you can do that is not to put your picture up on your profile, and not to call yourself Grandma, Gammy, any of your nicknames, so that the public can see it. My third suggestion is you need to have your profile completely locked down. And then finally, it's important to watch the groups that you're in. If you're in an elder group on Facebook or a widows group on Facebook or whichever social media platform that you're on, people troll those sites looking for elderly widows or widowers. So those are my suggestions for making yourself as most anonymous as you can. Put your dog as your profile, and make sure that you're not calling yourself a grandparent or speaking about your age or giving out your personal details online.
Thank you. We have a few questions for Judge Allen here. I serve on the Area on Aging Committee, and I agree with you. Seeing seniors in communities is a real problem right now. While we want to protect our seniors, the mental health issues are vast. Can you demand to see your loved one in a community?
You can always demand. Right now, they have the right to keep you out per some of the orders that are in place. HHSC promoted some guidelines. Honestly, I think they're, I won't say lip service because they're written. So I would demand it. Certainly a window or a door visit, absolutely. COVID doesn't get through the door, in a 10-minute visit or through the window, and I'm talking about a closed window. They, wouldn't let me open or wouldn't let my grandmother open the window. I think certainly phone calls and maybe even FaceTime, especially if you've provided the iPad. I really think they need to be doing that, and you can demand those things. As far as an in-person visit, like I said, I've seen the hospital exceptions to no visitors, even with COVID. So it's not easy, but I do encourage you to fight to see your loved ones in some manner. But I don't think you're going to be able to demand an in-person visit for a nursing home facility and be successful.
Thank you for clarifying that. Judge Allen, in some situations, Alzheimer's disease and other dementias are not treated as medical. They are treated as mental health. In these situations, medical power of attorney does not have any bearing. Is there any way that designees can have more say in these situations without having guardianship?
I'm not certain I fully understand the question. What we see in my court with Alzheimer's is sometimes there's a power of attorney, but the person who has Alzheimer's says sometimes, oh yes, Karen, you can make decisions, or you can have access to my health information, and you can help, and you can use the power of attorney. And then the next day they tell the doctor, oh no, Karen has nothing to do with this. I don't care about that power of attorney. I'm making my own decisions. And that's where we do see court intervention sometimes is necessary. I am a big proponent of temporary guardianships, especially with Alzheimer's. You can get a temporary guardianship. Usually they're only good for 60 days, but if they're contested, meaning a general denial filed by the court attorney, they can be extended for a lot longer. And sometimes with Alzheimer's, and this is unfortunate with the disease, it starts out with, no, I don't want her to make my decisions. Yes, sometimes I do. And as the disease progresses, then they allow that power of attorney to start making decisions. So sometimes we can put a temporary guardianship in place, and it gets them through that time. And so that can help. But if your person is fighting you on the POA, unfortunately that's sometimes where you've got it to get into litigation, and that just depends on the type of dementia and your loved one. I know my grandmother got a little combative for a time there, and I was very worried we may have to look into a guardianship, but luckily that time passed and we were able to get through that with the documents in place, and now she's really letting the decisions be made by the agents she's appointed.
One more question, Judge Allen. Can you please explain the difference between a will and a trust, and what are the benefits?
Okay, well, let's see. A will is gonna say, when I die, my assets go to these people. You are, most of the time, to transfer those assets, you're going to have court intervention. Now, like I said, it can be 10 questions. If you have a trust and you fund your trust, I think Karen will agree with me, don't just set up a trust and sign it and think you're good. No, you have to put your property, like your house, into the trust, and then upon your death, it will, the trustee can administer that trust, or sometimes it dissolves after your death, so it goes to your beneficiaries. You can actually avoid the probate part. But if you don't fund the trust, then you're back to needing that will, and that is a big issue. And I want to say one more thing. I'm just going to take a little privilege. Lori talked about catfishers. And sometimes I see people filing things in my court because of financial exploitation. My court cannot get to you as quickly as Adult Protective Services can. It's my understanding Adult Protective Services can freeze accounts, or they can certainly notify banks, and banks are going to be like, whoa, we might have an issue here. They're probably going to freeze those accounts, at least for a little bit. So I do agree with her, calling APS, calling law enforcement, the Financial Exploitation Center, because they can get to you a lot quicker than our courts can with guardianship and things.
Thank you. Ms. Telshaw Johnson, I have a couple questions for you. You mentioned that advanced care planning is for everyone to consider. What options exist to get these documents completed if resources are limited?
All right, so a number of hospital systems do have these documents, the statutory documents, online. And for consumers, there's also a site, texasprobate.com, has these documents for consumers online in PDF and in Word format for that usage. And so I would look to those two sites. I did want to go back to the last question just a little bit. We have the medical power of attorney, but it is limited. It does not include mental health treatment. And there's a separate document for mental health treatment, and that's usually limited as to what the patient would want. Do they want electroconvulsive therapy? Do they want certain medications? And that document is certainly to be looked at with a physician if that needs to be put in place. And I do have clients who have put those in place, and that can be helpful for a family as well.
Karen,
so I just wanted to add to that.
That's the new one that we just got.
That's the
a couple
new one.
years ago. Okay, good.
Yes.
That is a great point. I'm glad you brought that up, because the patient can say what they want. They also can say what triggers them. So if they have a mental health issue and let's say they're a veteran, they can say, don't approach me from behind, because when I'm having one of those flashbacks, I think I'm back in Iraq, and that's gonna make things worse. You know, maybe a woman's better to approach that person, something like that. Good point. Glad you remembered
They can
that.
put those needs in that document.
Okay, thank you. Another question. I'm the spouse of a person in end-stage Alzheimer's disease, and I've experienced some challenges utilizing a durable power of attorney in financial matters. I'm told that no other documentation should be necessary beyond that durable power of attorney. Do you suggest any other documentation?
So the financial power of attorney is very helpful, but it is a state-authorized document, and banks run and operate off of federal law. A lot of times each institution will have its own documents. So like my brother is a custodian on my bank account at Compass, and Compass wanted their own documentation even though he's also on my power of attorney. And so you need to talk to your financial institution and find out specifically what they want. They're not bound to it. However, if there is a rejection of the financial power of attorney, there are also statutory guidelines as to appealing that decision and that process and eventually ending up in court. So there is legal remedy there. Good question. Thank you.
One more, and this could be for Judge Allen or other panelists. Can you explain what a Miller's Trust is?
I am going to defer that to our planning attorney. On my end, I see after you've done those documents or not done those documents, which makes it even worse. But yes, I'm going to let Karen explain that.
A qualified income trust, otherwise known as a Miller Trust, is for Medicaid planning specifically. And so in order to qualify for Medicaid, there has to be an asset level and an income level, and those are bound by state regulations. And so in order to deal with income that may be over the cap for qualifying, you can use what's called a conduit trust, a qualified income trust, or Miller's trust in order to help get that income low enough in order to qualify for Medicaid. It is a specific document with subject to a lot of Medicaid planning, and so you can't just go in and say, I need a Miller trust. We really need to kind of go through a process to make sure that fits your needs long term. But that's what that is. It's specifically due to Medicaid planning.
And I might add, I am not a planning attorney, but I play one at the Tarrant County Probate Court. And so I just wanted to say that there is a booklet called the Elder Law Handbook, and it is published on the Tarrant County Bar Association website, and it will explain a lot of those really, it's hard to get it really quickly, but that is in writing, and it's about 90 pages and will tell you everything you ever wanted to know. Karen participated in writing it with me. I was super impressed with it. All I did was put it together, but it's a fabulous resource. If you have these types of questions where you just want to know, what do I do this? How does it look when I probate a will? What does it look like if I want to, or if somebody's fighting over my remains? How do I leave my remains? That sort of thing. It's all in there. Smart attorneys like Karen put it together and contributed to it.
It's a great resource for our community.
Excellent, thank you. We have one more question to squeeze in here. As you were speaking, this question came in. Regarding financial responsibility, how can we get banks to work with us better?
Well, I guess I'll answer some of that. With the DA's office, what we do is we have a liaison with the bank, and we have them to breakfast at the DA's office pre-COVID, of course. But there are fraud investigators as far as they work very closely with law enforcement. So if the question is how they work with law enforcement better, then there's a networking component of what we do with financial institutions. In addition, when I subpoena somebody's account record information, I make sure to make them aware of what Judge Brooke Allen was saying, which is you have the responsibility, banks, for watching out for your elder patrons. It is your job and your duty under Texas law, when you see something that is suspicious, that you notify APS. APS is really kind of the tip of the spear for stopping the proceeds of elder fraud. And they have great relationships. They can stop funds in a victim's account. However, I can stop funds in the recipient account if I can catch them. And so we all have to work together to make sure that those monies stop getting transferred. But that's sort of how the working relationship goes. So we work very closely with APS, and if they need money frozen by me, they get in touch with me or my investigators, and we make sure that happens.
I would add one thing to that really quickly, in that a lot of the power of attorney documents, the older documents before the changes that were made to it in 2017, the banks don't like those. They don't have provisions that specifically relate to their institutions. But in the 2017 legislative session, they literally sat down and said, we want these in the financial power of attorney, and they were placed in them. And so it's important to have updated financial powers of attorney that have the banking provisions, and that way there's a greater chance of utilization with those institutions.
Thank you. And Karen, for those whose relatives are out of state, do these documents apply across states?
If it was validly effective in another state, then it's typically validly effective in the state that you're in. However, these laws are state laws. So each state does prefer its own documents. You have better use of them if you're using your own state's documents, but they're still valid in other states, yes.
Thank you. Thank you so much again to our, sorry.
I just wanted to add one more thing about how can individuals get banks to work with them better. One way is to encourage your bank to become a dementia-friendly certified business, and then they get that education and awareness about what dementia looks like, so that when they encounter the person living with dementia, they know how to better respond and can reach out to the other signers on the account to get some help so that situations don't go more badly.
Excellent. Thank you so much, Gail. And thank you again to our panelists. And if our panelists can please remain seated, we will have Commissioner Brooks for his closing remarks.
Wow, I am so impressed with the level of information that you have provided to not only help protect our elders and those suffering from Alzheimer's and dementia from physical abuse, but also to help protect them from financial abuse and family abuse and the various other kinds of predators and abusers that they are likely to encounter in their vulnerable states. So thank you for participating in today's panel. Thank you for the advice you have given on how to relate to our loved ones and the institutions that are caring for them during this pandemic. That is a very important topic on which our caregivers are not getting very much advice. It's good to know that Adult Protective Services is the front line to help, that they are the tip of the spear. Judge, can you tell us how to get in touch with Adult Protective Services?
Well, I'm going to defer to Lori because she
Lori?
works much more closely than I do.
You can call 800-252-5400. I believe it's on my last or next to the last slide if you want to put that up. But yes, or you can also refer online. But be aware that if you refer a situation online, it may take 24 hours to get through the clearinghouse. If it's an exploitation, they have 14 days to make contact with the person complaining. So just know it will be 14 days before they can get a contact made with you, but doesn't mean they're not working on the complaint otherwise. And then it's a much shorter response time if someone is actually in danger of their life being threatened or something like that.
And I will say APS can come into my court and get certain orders in place as well. So they do a good job with that.
Good. There are a lot of moving parts to this, but thankfully, at least in Tarrant County, they mesh like gears in a wheel. And we all try to work together to improve the outcomes for the people that we are serving. I thank you all for participating in this seminar today. Those of you who are on GoToWebinar, those of you who are on Facebook Live, I hope you found these sessions to be of great value as you continue to care for your loved ones who are in the Alzheimer's and dementia journey. Again, thank you to our sponsors for today's event, the Alzheimer's Association of North Central Texas, the United Way Area Agency on Aging, the UNT Health Science Center, Center for Geriatrics, Dementia-friendly Fort Worth, United Healthcare, Aetna, Cigna, Texas Health Resources, Baylor Scott & White, and JPS Health Network. Thank you to our moderators, Dr. Jennifer Severance, Assistant Professor of Geriatrics at UNT Health Science Center, Fort Worth, and Dr. Sandra Davis, Assistant Professor of Internal Medicine and Geriatrics at UNT Health Science Center, Fort Worth. Thank you to the Precinct 1 staff. This event could not have been done without you. Thank you to our honorary staff person, Rachel, and thank you to the IT people behind the screen. Technology is way over my head, and we needed expert assistance in putting this on. Before we sign off, I want to tell those of you who are on GoToWebinar that there is an extremely valuable video that you can access in the chat box right now. It's called Pieces of Memories, a poem to Alzheimer's by Alia Pierce. Thank you all for joining us today. Thank you, Mr. Polk. Thank you to the entire Precinct 1 staff. And I hope you all found this to be a valuable experience and that you got many of your questions answered. This ends our 5th annual Alzheimer's Healthy Lives Matter event, and we thank you all for your participation.